be able to assess. All right. Give me a second. Dami, you can confirm when you're able to see my screen and try to accept everybody in the waiting room.
Okay, your screen is live now.
All right, thank you. Okay, so once again, welcome to the maiden edition of the African Youth Dialogue on One Health and Sustainable Livelihood. To start with, I would like to present about the organizers, which is One Health in Action Initiative. So what is One Health in Action Initiative? We're basically just a group of youth that are transdisciplinary by nature of profession, and our aim, our mission, our driving force is to attain health equity for humans, animals, and the environment through the operationalization of the One Earth approach across board in Africa. So One Earth in Action Initiative is a youth-based and youth-led organization, and what we do is to try to attain health equity within the human and animal populations, and by extension, between human, animals, and the environment. So One Health, as we all understand, is a very complex and a broad topic, and it will be very difficult, especially for youth organizations, based on the resource, like the level of resources that will be available and all of those kind of things. There are plenty restrictions that we would have as a youth-based organization. So as such, we have chosen to focus on the 4 pillars of One Health implementation, rather than going for everything, which we might not be able to do at the moment. So our foci, the 4 things we focus on at One Health Action Initiative, are communication of One Health action, collaboration with partners and stakeholders to implement One Health framework in solving problems facing health and socioeconomic well-being of humans, animals, and the environment in Africa. And we also attempt to coordinate One Health actions that are youth-based within our capacity. And we also try to build capacity of members of our network, and also African youths that are interested in One Health by extension. So, sorry. My slides are too happy. So we have 2 missions, and these missions conforms to the phases of our strategic plan. So in the first phase, what we attempt to do is to decentralize access to knowledge and skills on how to unify multiple sectors and creating sustainable solutions to health and socioeconomic problems for the benefit of humans, animals, and the environment, especially in the global south. So our area of jurisdiction is the global south, but of course, One Health is a global concept and a global affair, so it will be difficult to restrict our activities to the global south. But our focus, the baseline for our activities, is the global south. We want to expand knowledge and skills on One Health implementation in the global south. So in the first phase, we'll be conducting a lot of awareness creation activities and dialogues, and engaging with other youths and stakeholders in trying to create sustainable solutions to health and socioeconomic problems. And this event is, essentially one of the ways in which we hope to achieve that. And just for your information, this is not a one-off event. We'll be hosting this every year. So this happens to just be the maiden edition. So next year, we plan to have an hybrid event. And further details about that will be communicated moving forward. So we're happy you are here, and thank you once again for being part of this movement. So In the second phase of our strategic plan, which will conform to the second point on our mission, we plan to put the boots on ground to actually facilitate the implementation of the One Health approach in solving problems with our healthcare system, and also, the socio-economic determinants of the health itself, right? So, so these are the two reasons why we do what we do. These are the things we hope to achieve in the long term. So specifically, the quick wins for us. These are our objectives. We want to propagate awareness about the One Health approach and how the approach can benefit communities in the global south. Then we want to help with the technical frameworks for One Health implementation, communities at national, local, and an international level in the global south on how to implement the One Health framework for their operations. And of course, so our third objective has to do with something very specific. We all depend on food. Food is the reason why everything lives, the ecosystem. The whole structure of the ecosystem is based on the need and the demand and the supply of food. So we want to play a role in that by facilitating the access of actors in livestock value chains in Africa with information and opportunity that will enable them contribute more to food security in Nigeria to start with, because we're domiciled in Nigeria. But of course, we have interest in expanding to other countries moving forward. And lastly, we want to promote best practices as regards sustainable consumption and production of food and other materials. So consumption of food and non-food items is something that affects human, animal, and environmental. I'll give example of our clothing and packaging materials. When they are made out of cotton or something that is biodegradable, they have lesser negative impact on the environment. But when they are made out of plastic, what happens? They pollute the environment and they make life more difficult for humans and animals. So the team, we are currently operating on a very lean team, and this is not written in stones yet. Things change very frequently, but these are the members of the admin team at the moment. Top left, you see Dauda Ayonawala, that's myself. We have Courtney Dillingham, our programs and partnership consultant. We have Elizabeth, our secretariat, and we have Bolanli, who is on the call right now, our media advisor. We have Ibrahima Koma, an Ivorian, who is our outreach advisor, and we have Nathaniel Ashai, head of content development. And more importantly, we have working groups now that are presently undertaking a lot of our activities. We have working group on One Health education, which is the most active working group on our team at the moment. So what they do at the working group on One Health education is to try to educate the general public, not just the team, to create programs that will conform to open education of the general public on One Health, the concept of One Health itself, and actions that can be taken locally to achieve the One Health status at community level. So they are currently engaged in creating a course that will be open source for everybody to access, and when it's out, you see that on all our social media and those on our website. So we have a working group on climate action, the media and publicity team. We have a research team, and we have a working group on antimicrobial stewardship, and then we have a One Health seniors team, zoonosis education team. All of these teams are all working to make sure we create projects to achieve our set out objectives. So just a few of our projects before we go. We have the One Health Daily, which is a collection of sayings of perceptions of experts and individuals on the concept of One Health itself. One Health basically looks very complex and professional, but from individuals, from professionals, there are different perspectives to it. So we want to expose people to these perspectives, and it all boils down to good health and well-being for humans, animals, and the environment, right? So we want people to understand it from their angle of view. Our reason for creating that project is that if I, as a veterinarian, talks about one, it may be difficult for a human health professional or microbiologist to understand certain components of what I'm talking about. But if a microbiologist or a human medic or a social scientist or someone within somebody else's domain of work comes to give a narration about One Health, then it will be easier for them to understand what they're talking about. So we want people to have a better understanding of the concept of One Health. That was why I created that one. And then we have zoonosis and biosecurity card. We are simply trying to propagate preventive measures on zoonotic diseases with this particular project. And we have the One Health scenarios, which are basically case studies on One Health problems and how they have been solved, or how organizations or individuals have attempted to solve them. So very frequently we bring on board people that have done something in this regard, that have used the multidisciplinary approach to solve a problem, to come on the One Health scenarios program and speak. So it's usually a 1 hour webinar, and then the webinar is mostly recorded, and we put it up on our YouTube channels, and everybody can view afterwards. So on the pictures, the third picture from the left, you see One Health scenarios. That was the second part. And we brought someone that developed a guide for climate action on board to come and give a narration on how to use that guide as a tool. So we also have the Prioritizing Antimicrobial Stewardship podcast. We bring experts on antimicrobial resistance onto this program to speak about their experience and one specific action that they would like to encourage people, like the common people, to take to mitigate the impact of antimicrobial, or to prevent or to slow down the development of resistant microbes. Then we have the African Youth Dialogue, which is the one we are presently on. Then we have our newsletter. The next edition is coming out soon. And like I said, the One Health course for beginners is coming up shortly. So in case that will be all, in case you have questions, just for us to save time and make sure it's business strictly on this call, I won't be taking questions regarding the organization, what we do and everything at this point, but we will be taking questions later on, maybe tomorrow. But if you need urgent answers to your questions, you can easily just up onto any of these contacts, and then we'll be there to respond to you as soon as possible. All right, so let's go to the business of the day, right? So once again, welcome to the first edition of the African Youth Dialogue on One Health and Sustainable Livelihood. And I will give a brief explanation of the logo of the event. Like I said, it's going to be annual, and this is the maiden edition. We'll be doing this again next year. So as you can see on the left, there are 4 icons indicating each pillar of the One Health implementation. So the first one, communication, followed by collaboration, clockwise, then capacity building and coordination. So on this call, what we are doing now is trying to build conversations around what specific actions are relevant to the local scenarios. Of course, we have people from East Africa on this call and West Africa mostly, but we're expecting people from South Africa and North Africa as well. So we want to harvest opinions and narratives on how best to communicate, or what are the challenges you're facing in communicating problems, for example, antimicrobial resistance or sustainable agriculture with people, and how you think they can be overcome. Then we are looking forward to see some collaborations germinate from this particular call. And yeah, by this, some of our keynote speakers have donkey years of experience in One Health and sustainable livelihood. And definitely, so by that, we also building capacity of the people that are on the call. And lastly, well, we are putting ourselves in that position here today to coordinate this particular program. So as you can see, yeah, the program itself is inherently a One Health approach, and we want to expand that. We want to make that happen to a real life problem, and that is why we are here today. All right. So why did we think that it is necessary to have this call today? All right. So I'll give three scenarios that have negative impact on the environment or are not sustainable that I think should be changed in three different situations. Then I will tell you what we expect after this call. Now, let's start from the forest. So when you have people, indigenous people around the forest area, and they have to eat, right? They will eat food, and then they have to maybe go to farm, or yeah, they have to eat food. So what we see mostly, especially I'm speaking for West Africa now, is that people, they will just go into the bush and then kill a wild animal. They will eat it, they'll say it's bush meat, and that's it, right? Then for their food need, without regards for the impacts, they will just look for an area of the forest they will clear, or they will get logs of wood, they will cut it down to sell and believe, okay, that is a way for them to get money, right? But we all know when you hunt, you're number one, you're bringing yourself closer to a wide habitat, which also increases your chances of exposure to viruses, pathogens in general that are not commonly found in human population. So number one, you're exposing yourself to a zoonotic disease, right? Then secondly, you are going for an unsustainable option, an option that is not sustainable for your animal protein demand, right? Because most wild animals they don't reproduce at a rate at which you can just continue to eat them for the exploding human population. So you see, that is a narrative that has to be changed. People in peri-urban areas that go into farming, they're using organic fertilizers, and they do all sorts of things to improve their yield, and so that they can get more money, more food, while all of those things are not friendly to the environment. And yeah, at the long run, they will damage the soil and nothing will be obtainable anymore. So in the cities, materials and everything we consume, we tend to use plastic a lot, and that is not also favorable for the environment. So on this call today, we'll be talking about scenarios like that, and what are the things that can be done, and what are the immediate actions we can take, and how can we proceed from there. And so these are the objectives of the, I don't need to narrate all of this again. They are in the brochure that has been shared with everybody earlier on. And these are the theme areas: ecosystem health, like I just narrated. I don't need to go over all of this again. And what are we expecting at the end of this, so that we don't know, okay, we are just here for an event and it ended there. So we have a plan to come up with a white paper report after this event, so that we can communicate with not just the participants, but also concerned stakeholders, for example, governments, NGOs, and CSOs that operate close to the people and the people themselves. So after this event, whatever your inputs are, you should be very certain they'll be taken very seriously, and they'll be taken further from here. It will not just end here. And when we are having the events next year, hopefully we'll have some stories to tell about actions that emanated from the discussions we've had in this meeting. So, all right, so I've taken a little bit too much time. Thank you. Everybody understands English. Asante for the Swahili speakers. Merci for the French speakers. Shukran to the Arabians. Gracias to the few that will be speaking Spanish. So that will be all. If you have, I'll be taking 2 minutes to answer questions regarding what I've just presented, basically. And then afterwards, we will take our first speaker, Dr. Fashina Oludayo Folorunshaw. If you have questions, please type in the chat box. We'll be ready to receive you. All right. I guess there's no question. It's either I was too fast or I was anyways, I hope. All right. So let me introduce to you our first keynote speaker. I must confess we are very lucky to have him here, and he would agree absolutely with me. We almost did not make it, right? Let's say we almost did not make it to get him here. He's, the very successful as we have prayed for, and it's always very difficult to get attention of such people. So Dr. Folorenshaw Oludayofashina is a distinguished academic researcher, an international expert for that matter in the field of veterinary medicine, infectious disease, epidemiology, and global health. Right? He has an extensive career spanning across academia, research, and leadership roles in international organizations. He has made significant contributions to your understanding and management of infectious diseases of animals, transboundary animal diseases specifically, and zoonotic diseases in general. He has also worked in the space of global health security, antimicrobial resistance, animal health economics, human and animal disease epidemiology. So he's a prolific researcher with over 220 peer-reviewed publications. I mean, before I proceed, I need someone to use the clapping hands reaction here. 220 peer-reviewed publications. Publishers are still dealing with people like us. So his research mostly focused on his area of expertise, which is infectious disease of animals and humans. And he has supervised over 48 students in various academic levels, mostly postgraduate. I mean, all right, I can see the clapping arts reaction, so I think we can proceed here. So he has also presented at 87 peer-reviewed and popular international conferences. I wouldn't say anymore. I would give him the floor to make his first keynote presentation. Thank you very much.
Yeah. Thank you and good afternoon. I believe that you can hear me clearly.
Yes, sir.
Okay. Yeah, thank you. And I want to first say that thank you very much for giving me this platform and for calling me to be part of this important meeting. Let me start by saying you can see I'm also dressed like a youth. I'm also one of the youth. And what happened was that this afternoon, I was talking to my son and I told him, oh, I'm presenting and I'm looking for a tie. He said, Daddy, what do you need a tie for? I said, because I'm presenting to the African youth and all those things. He said, well, if you put on tie and you dress formally, you feel odd among the youth. So he advised me that it's not the right thing to do in putting on a tie for an event like this. That's one. Secondly, even the earpiece I'm using, I used to use those small earpiece from the aeroplane. And he told me, no, Daddy, this does not fit you. Then he bought me this and gave it to me. So that shows you the power of the youth, and that if you fail to connect to the youth, you are left behind somehow. And before you know it, the whole world moves on, and you are struggling to actually connect with them. So really, in terms of finance, everything is contained in this cycle. You see, you either fit into the environment cluster, the social cluster, the economic cluster, the farming cluster, or the supply chain and all those things. So if you find what you are doing does not fit into this context, you need to begin to have a relook at what you are doing. Because that is one of the challenge with a number of our older colleagues. They felt left behind, they felt disillusioned, and they felt angry at times that why is the world moving on without them? The world does not stop at any point in time for anybody. You either connect and move with the world, or you are left behind. And One Health is actually one of those interface and the approach that you can use to gain an entry and to be part of the moving. So coming to the keywords from that title, there are three key words I found: the One Health itself, livelihood, and then the global health. And when you talk of One Health, we know that is the integrated, unifying approach that aims to sustainably balance and optimize the health of people, animal, and the ecosystem. When you talk of health itself, you know that health is a complex term because it has to do with the welfare, both in terms of physical, social, even economic well-being and mental well-being. Everything is contained in health. So it's not an isolated issue. And when you talk of livelihood, we are talking about a means of securing the necessity of life. For example, you know the status of a man in the home front by his ability to provide for the family. You know the contribution of a woman in the household by the ability to be able to contribute to sustaining the livelihood in the household. And you see that children, most of the time, they brag about their parents doing well because they know they have means of livelihood and they are contributing meaningfully. So we'll be looking, what are the capacities in One Health that we have in Africa? And what are the global health challenges that we have in Africa? When we talk of global health challenge, I may not be talking of malaria or brucellosis or zoonosis or AMR. Why? Because we are talking of the environment health, we are talking of human health, we're talking of animal health, and we are talking of the ecosystem health in general. So we look at it a bit differently, and we look at what can we be doing as professionals, as persons with skill, to be able to key into One Health appropriately and solving the challenges that we have in Africa. I want you to know that this presentation is not merely academic, but it's practical and something that can provide solutions to what we should be doing. So I picked this picture on the right-hand side from the concept note shared by the organizer of this meeting. And I look at the arrow there, and I say, is the arrow actually pointing right? Are we moving from city and coming towards reforestation and things like that? I rather thought that the arrow should have pointed the other way around because we cut down our forest, we destroyed the use this as a platform to begin to look at some of the solutions we can advance. For example, if you look at this picture here, if you are from the Southern Africa or if you've lived in South Africa before, you will know this picture very well. On the left-hand side is Soweto. And just to the other side of the road is where you have Deep Clove, you have Meadowland, you have Sandton, you have all those places. Indeed, Sandton is touted as one of the richest space per square kilometer in Africa. And you can look at Soweto on the left-hand side, which is also called I think the largest slum in Africa. Is competing with the slum in Kenya. There's one in Kenya also, and the two of them are competing for which one is the largest. But here, what we are looking at here is transitioning an imbalance in terms of spread of infrastructure. You know, definitely cities and urbanization will continue to be because human population is expanding. We are growing in wealth, we are advancing in technology, and we are introducing new concepts of cities into our livelihood. But when these are not done with careful planning, you will be building the slums as you are building the city. For example, when Abuja was starting up, you know, the Nyanya, the Karimo, and all those things were not part of Abuja. But they were building the city for the high-ranking officer, forgetting that these people will need drivers, they will need cleaner, they will need house help, they will need people who will wash their car, people who will do gardening, people who will do security. And those guys cannot afford accommodation in Wuse, in Garki, in all those major cities. So definitely they have to live somewhere. And that was what led to the development of cities or peri-urban city, like the Karimu, like Nyanya, like the Soweto we saw here. So in terms of our planning, we need to begin to factor this into consideration. So when we also look at population density, it's also one of the issues that are driving the issue of One Health and the global health challenge like we have in Africa. Up here is the population density of the world as per the year 2022 in terms of the pictorials. And down there, we saw the picture of COVID on the left-hand side, the picture of avian influenza in the center, and the picture of African swine fever to the lower right-hand side. If you look carefully at those pictures, they almost simulate the population density, because as human population continue to increase, each of these disease driver will also continue to increase. We are incurring into previously uninhabited environment. We cut into bushes. We go there to offend those viruses and bacteria and fungi that live in those places. And we think, oh, we are just driving them further into the bush. No, they continue to live with us. And then they may challenge us back. It's like somebody come to your house and open your door and begin to want to occupy your house. You will fight back. The same way the bacteria, the viruses, and the pathogen, they fight back when we incur into their environments. If we look at this picture, this is a swampy area. I took this picture in the Southern Island in Tanzania. What we saw here is actually a sort of a picture of epidemic waiting to happen. One, we know according to good agricultural practices, we are not supposed to raise pigs and poultry together. Why? Because pigs, the lung of pig, have capacity for 2,3,6 sialic acid. And so it can, the receptors for 2,3 and 6 sialic acid, that of chicken is 2,3, that of horses and human are 3,6 sialic acid receptors. And so pig can serve as a mixing vessel for a disease like influenza virus. So pig basically can combine diseases from chicken, influenza from pigs, influenza from swine, and influenza from human, and mix all of them together and redistribute them through genetic drift or genetic shift, and now redistribute back to human, to chicken, or to horses. And so that was why there was this rule that typically you don't keep pig and chicken together in the same environment. But in this picture, we have some chicken coop that we saw within the locality. We have a number of local pig building in the environment. We have the cow right there in the central left-hand corner grazing. We have the swampy area, which is suitable for bacteria and parasites. And we have some human residences in this place. So what does this tell us? Unplanned city. One, this unplanned city can be due to absence of land registry, wherein there is no proper land planning. There is absence of land use management, so people can do whatever they like in terms of utilizing land resources. Massive unforeseen rural-urban migration. You know, we also have it at the back of our mind as Africans that the more we move into the city, the more elite we become. That may not be completely true, but that is what stays behind our mind. That how can I stay in the village after having my degree? Which is a wrong concept, but that is what we believe. We believe that civilization means moving into the city. So general lack of planning is also seen, as well as poor governance. Because when you have poor governance, or you have governance that can be bought and tricked, then you see people bribing their way to do things in the wrong places. You can see situation wherein in this type of environment, people can plant vegetables which they will sell in the market. And those vegetables, they use sewage to raise them so that they produce them quickly. And so it can drive antimicrobial resistance, can drive pathogen drifts to human, and a lot of situation can come along with it. We also can have lack of financial resources and long-term implementation plan for country. And all these result in increased vulnerability to infectious diseases. We've seen this happen again and again and again. Indeed, in Nairobi, there was a recent paper on that. So when we also talk of land degradation, these are some of the things that occur due to climate change or climate extremes. You see, like in these places now, the land is gradually being degraded and being wiped off by the sea. And we will see some of the reason or some of why we contribute to this. You can have extreme weather conditions. I've been to the northern part of Kenya, the northern part of Tanzania, part of Ethiopia, and part of North Africa. And you will see extreme weather conditions. And you see a lot of landed resources that are unutilizable for agricultural purposes. You can see drought, we can see soil erosion, we can see leaching, climate change. All these are reality. Human activity also. For example, we pollute the soil through maybe the waste we generate from the cities. We just dump them anywhere we want. We use landed resources for overgrazing, thereby overgrazing the environment and exposing them to vagaries of climate extremes. We do mineral extraction without planning. We do deforestation, we cut forests and just overuse chemicals. We overuse fertilizers. We do unplanned irrigation and desertification. All these are the things that are causing land degradation. We may also have unplanned engineering. For example, I took this picture. I was looking at this set of building, beautiful building, that notwithstanding. And if you look at the lower right-hand corner there, you see them trying to build a bank along the edges of the water. Meanwhile, there are palm trees that grow along these places originally. The question is, why do we have to cut down those palm and then begin to put concrete barrier? Can't we or couldn't we have used those palms and built around them to actually secure the environment? But no, human being will not do that. We rather want to cut them down and think that by cutting them down and building this and then using money to plant flowers again and plant tree, we believe that's the best way we can do that. In some area of northern extremes in Kenya, like Mandera, all those places, Garissa, we've seen a number of livestock deaths. Indeed, there was a time we were driving along those places. We saw carcasses of animals all along the road. Because, for example, in the last few years, over 4 million cattle, sheep, and goat died in Kenya due to climate extreme, due to drought. Indeed, just early this year, there was a situation wherein they were selling a whole cow for just about $7. That's about 1,000 Kenyan shillings. They were selling a whole sheep and goat for less than $500, 500 shillings. That is just about $3.5. Then you look at it, you look at the desperation in the faces of this farmer, this pastoralist, in order to save and secure something from their livelihood. And they don't even have people to buy this animal. And this was televised live on TV. So when we also look at a situation like this is farm and agricultural practices. The farm you see on the left-hand side there is actually a pig farm, but it has no single pig as of the time we got there because African swine fever came in and wiped off the livelihood of this farmer. Through that situation, the farmer has to withdraw 2 children from the university and another one from secondary school. So basically, his livelihood came to zero, and it also affects the generation coming after him because they could not continue their education. If you look at the right-hand corner there, you see that pig, you see the very dirty environment. This pig actually lived the whole of his livelihood on this trash. They keep pouring the food there, they keep pouring the waste there, and the pig doesn't have room to go out, and he lived the whole of his life there. And this pig will end up on the table for human being as meat, like you can see in the center there. Indeed, in this center, We visited this market in the northern part of Tanzania too. In this market, they slaughter this pig, and they contaminate the environment with their blood and with everything. And there is a place where they do pork chop. They roast it and sell it to people there beside the place where they slaughter. And you can also buy the pork meat and take home as food. And so this type of practices exposes human, exposes the ecosystem, and exposes even the animal to a lot of hazard. So from farm to fork approach, we need to begin to think of including the hazard analysis in terms of what do I do to improve this situation? How can I integrate my knowledge into what is happening here? And what can I do to improve things? Okay, this picture also I took in one of our journey across Africa. In this environment, it was interesting for me. I was asking myself, do we human actually own the environment, or do animals own the environment? And why did I say that? In this picture, if you count the number of dogs you see there and the number of humans, the number of dogs was actually 2 times the number of humans. And then I just thought of it. I said, come, let's say this dog begin to fight and decide to attack human in this particular picture. The risk of rabies to each and every individual that is in these places is very high, because this animal can actually attack. They are massive in terms of total number, far outweigh the number of human beings. And so, are we living in a balanced ecosystem? That is the question there. So, with regards to the concept of One Health, we need to begin to move away from just I know we have left the area of silo wherein we think of silo mentality, animal health face animal health alone, human health face human health alone, environment face their things alone, policy, economics, and everything. We are doing what we call multidisciplinarity, but we need to move forward beyond that. We need to transit into interdisciplinarity and be moving towards transdisciplinarity. And what do I mean by this? When you talk of multidisciplinarity, for example, what some sector do now is that, okay, we are planning an animal health program. Then we just inform the Ministry of Health that we'll be doing rabies awareness at the end of the week. If you have 1 or 2 persons, send them to come and see what we are doing. Is that truly One Health? I doubt. So when you talk of interdisciplinarity, now we begin to actually share resources actively in terms of planning, doing things, and all those things. And when you talk of transdisciplinarity, right from the planning to execution to financing and to implementation, we are doing it together. So nobody is brought in at the level of post-mortem, or nobody is brought in to come and observe. But everybody become an active participant right from the beginning to the end in terms of implementation and planning. So I want to talk about a few of the evaluation we've done in Africa, some conducted by me and my team, and some conducted by other researchers in Africa. One, when the One Health Research Center in Ilri was about to start, I was commissioned to evaluate the One Health initiative in Africa. And we tried to put together all the different One Health that have been found across Africa. We found out the highest density of One Health initiative still reside in East Africa, which is in excess of 101. We also have the next set of initiative in the Southern Africa, followed by Central Africa, and then West Africa. I must put a caveat here. The West Africa initiative may exclude the Francophone speaking initiative, because we focus more on the English speaking document that we can relate to. And that may be responsible for the low number we saw in Western Africa. But we are not interested in just the number, but we are interested in how active these initiatives are, what these initiatives are driving, what are the outcomes and what are the outputs, that key outputs that are coming from this initiative, and how are these initiatives influencing policy. That is what we are interested in. So we don't just want to speak One Health because it is SASI world. We don't want to speak One Health because we just want the next big thing. We want to be part of the next big thing on the stage. But we want to actually be driving change, and that should be our interest. We also look at about 8 countries: Tanzania, Kenya, Uganda, Ethiopia, Mali, Burkina Faso, Senegal, and Mali. And we evaluated their national One Health platform and other One Health initiative in the country in terms of their capacity for health system strengthening and health system contribution in real situation. And we evaluated all these parameters along six different parameterizations in terms of system thinking. System thinking, okay, in terms of One Health, when we are actually implementing One Health in the country as a One Health platform, do we integrate it in our everyday thinking? Or is after we finish our planning, we now think, we need to include, or we need to make it have a One Health outlook. So that's about system thinking. In our planning, detailed planning of activities we carry out in a year, are we integrating One Health into it? In terms of transdisciplinary working, for example, when we are planning as Ministry of Agric, Ministry of Health, the private sector, and all those things, are we involving other sectors in terms of our planning before we even start? When you talk of sharing, we have a lot of One Health resources in Africa. I tell you, Africa is not lacking One Health resources, but are they shared appropriately? Or it is only shared as a post-mortem detail, or only seen where it is published? In terms of learning, learning is continuous building on the knowledge we have currently to continually build on the power and the capacity of each and every member. And in terms of systemic organization, are we thinking of One Health? So these are the different scores we have across the world, and these have been published. You can see them in the reference. You can relate to them if you feel like you want to know more about them. What it shows that in terms of the African context, basically, our system thinking, our planning, and our transdisciplinary working is still weak. But in terms of systemic organization, we have strength in that in most African countries. In terms of learning, we have strength in that. Although we found that in terms of learning, the academic institution that started One Health seem to have more capacity than the government institution, like the ministries. So that means that there's a need for the ministries to be working with the academic institution if we want to build this capacity. So I also look at this One Health Index on zoonosis. What is the capacity of the different countries to be able to tackle zoonosis as soon as they occur, especially with regards to using the One Health approach? So one of the things we notice is that across sub-Saharan Africa, South Africa seems to be leading Africa. It had been published in the journal. It's available in the reference. I believe that the organizer will share this PowerPoint to the platform. So also I look at the One Health connectability chart. How are we connecting with the different sectors? For example, in terms of the animal health, science, One Health, the EU, the global policy, human health, the climate, the conservation, are we really connecting? What we notice is that in terms of connecting to One Health, really, animal health is leading with a score of about 2.76. To pass this particular score, you need to have at least 1.0, although 2.0 is a better score. So followed by human health, and then you can see all those red areas. It shows that in terms of policy, in terms of conservation, in terms of climate action, in terms of science, we are still underperforming in One Health. So these are areas that we need to begin to think of, even as One Health implementer, as different One Health initiative. These are areas we need to begin to focus on. Okay, how is the program we are designing focusing on policy? How are we integrating the conservation, the ecosystem? Because we see that some of these will stay in the fringe of implementation. The animal health, human health seem to be in the core of implementation. So One Health is not only zoonosis, it is interconnected. So we need to begin to interconnect every other one into One Health. So let's quickly go to some selected solutions and opportunity for the African youth. One, education and skill development. One, a number of us on this platform, and I believe beyond this platform, a number of African youth, we have a lot of skill. But are those skills matching what is needed for the future of Africa? You know, Future Africa 2063 agenda had been designed by the African Union. I don't know how many youth have actually read the 2063 agenda by the African Union to know what are the opportunities in that document and how can we as youth begin to keep it. I don't know if our education institutions are looking into those type of documents to design new programs, meeting the need of the future and helping the youth to actually be able to interconnect. You know, like 20, 30 years back, you think, oh, when I graduate, I just join the government, I work with the government and do one or two things. No, that is not the current trend. The current trend is what solution, what are the challenges I can see in my environment? What are the solutions I can provide? How can it create an opportunity for me? And how can I key in to solve the problem while I'm making a life for myself? So we need to begin to improve education and this talk to the government and to develop relevant skills. Skills these days goes beyond what you get in the university or the higher institutions. You also need to develop relevant skill, both hard skill and soft skill. For example, this particular platform we are using now is one of the opportunities to develop skills that are necessary for the job market. When we talk of agri development, we know that almost 70% of the population in most African countries are involved in agriculture. But we have almost 70% involved in agriculture, yet we cannot feed ourselves. We are still depending on a country like Ukraine that is fighting war to supply us with wheat. Should that not be a shame to us? Are we not supposed to be thinking differently? So we need to begin to think of promoting sustainable agricultural practices that are clement with the environment, at the same time giving us a cutting-edge technology. You know, I've been to the Netherlands several times. Indeed, to move from the top to the bottom of Netherlands is just about 5 hours, 15 minutes. And from the east to the west, without hindrance, you can cover it in less than an hour. How will you believe that Netherlands produce more dairy products than almost all the African countries combined, produce a lot of agricultural products and supplies us in Africa with agri products? A country that is less than the size of Kaduna as a state. Niger State in Nigeria is almost like 2.5 or 3 times bigger than Netherlands. It's almost like 5 times bigger than Belgium. And we are still depending on these people. So we need to begin to think differently. We need to think of providing modern farming and climate smart technique. We need to begin to think of reducing food waste. Indeed, just about 2 weeks ago, we have the World Food Program, and one of the social experiments that was carried out was about food waste. I will show it later as we continue. Another thing is in terms of healthcare infrastructure. Strengthening healthcare infrastructure is another opportunity and low-hanging fruit for us. What are the challenges? For example, we know that there is lack of connectedness between the city and the urban, between the urban and the peri-urban and all those things. How can we as youth begin to key into this? How can we deliver access to essential medicine? How can we target intervening in workforce training? Can we serve as NGOs intervening between maybe the development partner like the USA, like the UK aid, like the different development partner and the national government and the sub-national government, and begin to key into those opportunities, both for public health, for animal health, and for the ecosystem health. In terms of community health and frontline public and animal health worker, in 2022, we carried out an experiment in Kenya wherein we were developing a 5-year development program, and we brought about 60% of the people we brought into the meeting were actually from the sub-national. That means we brought in people from private sector, people from the local government, people from those places. And we sat them in the room and we developed a co-created solution with regards to the future of program planning. And at the end of the day, we got some very interesting results, which was published in the One Health, wherein the thing we will have overlooked, if we sit maybe in Abuja, or you sit in Nairobi, you sit in Dar es Salaam, you sit in Addis Ababa in our different headquarters and plan alone, what we will have bypassed and we will think is not important, we are coming up as important. I know somebody mentioned about the people left behind before. Their issue came up very strongly in that One Health planning. The issue of the pastoralists came up very strongly. The issue of people that live in the rural area came up strongly. Indeed, the issue of the women and youth came up strongly in that planning. When we look at issue of water and sanitation, actually this year World Food Day, the focus is on water. And the title, Water is Life, Water is Food, Leave No One Behind, came up. So how are we providing access to clean water? Well, is it not a shame to us as in Africa, after having universities for maybe more than 50, 60, 70 years, we still could not provide access to clean water in our rural area? Where are all our engineering knowledge? Where are all our rural development knowledge? What are we doing with them? Nutrition program is another thing. We know there is a lot of stunting and runting in most of our peri-urban and rural area. What are we doing with it? The knowledge we've acquired in school, can we begin to put them to use without necessarily seeking for government job to be able to do things? We look at women empowerment. There is no community or there is no society that can develop by leaving a section of the society behind. I led a project in Egypt at one time, and we were looking at the contribution of the women to household income. We found out that basically 60-70% of the household income and everyday need is actually taken over by women. Strangely, the men thought that they are the one doing the major thing, but everyday need is what the women take care of. It's only major things and major investment that the men put their money into. So, but without those everyday needs, we cannot survive as a society. So the women empowerment is important, giving them access to education, access to healthcare, and economic opportunity. Being intentional with including them should be one of the things we should be thinking of. Infrastructure development is another area. We can key into this, and our engineers, our architects, and all those things can think of that. You talk of infectious disease prevention and control. There are a lot of opportunities for us there. Vaccination program, disease surveillance, early response, advising government in this area. Collaboration and partnership. We as youth, we can form ourselves into cluster and say we want to intervene, we want to do something along this area. We can look at area of data technology. Now, can we actually do without data? Can we do without technology? AI came up just like yesterday, and journals, academic institutions were saying, no, we will not accept AI, we will not do this, we will not do that. But that is changing now. I was speaking with my son this morning and was asking him, in your school, do they allow you use AI? I said, yes, now we are allowed to use AI in terms of assisting us with doing our assignment and all those things. The only thing is that we will not be allowed to use it to cheat. So definitely, these are areas that we need to begin to key into. Recently, I listened to the former minister in terms of IT infrastructure in Nigeria, and he was saying that globally now, there is a shortfall of almost 4 million data security experts globally. And so anyone who can key himself into those areas is not only needed for Africa, is needed anywhere in the globe. And so a lot of youth are keen into it. What are we doing as African youth? We need to begin to think rightly. Climate resilience, this is another big area we can key into. So sustainable economic growth. I actually took this picture up. This is a live picture of a situation. You can see those oranges. You can imagine the effort that has been put into producing this orange by a farmer. And now see the volume of orange that is wasted there. And on the right corner there, at the lower side, is the experiment, the social experiment I said was carried out during the World Food Program in the FAO headquarters in Rome. They were measuring every day what are the quantity of the food that people eat and that are wasted. You see, the arrow goes from green towards the red. And so the different food items were divided into animal products, root and tuber, fruit and vegetables, and then the others. And you can see on daily basis, we found out that averagely almost 21% of the food served are wasted. So if we waste those 21%, and yet we have millions and millions of people who don't have food, what are we doing with those wastes? Are we converting them into other food that animal can use to reproduce, or that we can use as fertilizer or things like that? If you look at the lower end there, these are peri-urban waste that we see. What are we doing about it? Are we thinking of, okay, we want to form ourselves into cluster, begin to process waste and use it to improve our economy? In terms of the final one I would like to talk about is policy and governance. This dealt or sits squarely with the government. Government need to take leadership in this, because it's government that set policy, it's government that lead governance. So some of the youth who find themselves in government or who find themselves in leadership position, you need to begin to think clearly. For example, I look at the Sustainable Development Goal. The 10 leading countries, there is no African country there. And when we look at the African country, the first African country is at number 89 out of the whole country in the world, which is Cabo Verde. Cabo Verde is one of the small islands around Africa, then followed by Mauritius, Namibia, and then the top 10, you can also read it from bottom there. We have Equatorial Guinea, South Sudan, Central African Republic, Chad, and all those things. Even this one that are at the bottom, this gives us opportunity. Can we begin to move? For example, if you have an over concentration of veterinarians or medical doctor in Kenya or in Nigeria or Ghana, for example, can we begin to move into all these countries that have less resources and begin to capacitate them? These are opportunities for us. So in terms of, I'm moving towards the conclusion now. These integrated solutions that I've spoken of, they are not limitless. There are many more that we can think of. It's just to kick us into that thinking mode, so that we begin to think rightly of how we can integrate the different solutions. They need to be coordinated by government. Government, both at the national, the sub-national, the regional, and global government, in terms of enabling policies, in terms of catalyzing the livelihood opportunities, and making it available to the people. We need a non-governmental organization, and this is one area where youth can key in. We can form ourselves into non-governmental organization. I remember I think about 2 years back, when this One Health initiative that is launching, or that is catalyzing this particular forum, when we are talking, I was talking with Dr. Nawola. He was telling me some of his challenges and all those things. I know that they are not where they used to have those challenges again, but they can still move forward. And this is what we can begin to do as youth. You finish, you don't need to, yes, you can look for government job if you find it. If you don't find it, what can you do with your fellow or with other professionals? We can look at local and frontier community. What can we begin to do with them? The non-governmental organization, the faith-based organization, community-based organization, indigenous people, underserved people, the underprivileged people. How can we work with them? The regional and local context, we need to bring them in. And as I mentioned before, youth and women, who are the catalysts of change. You cannot afford to leave them behind. So in terms of this, so we have, I've partitioned some areas where we can key in there. You have nutrition, data technology, infectious disease education, agri development, different things. So there are so many areas by which we can key in as youth, in terms of looking it from the prism of One Health and keying in and bringing in development. So the question is, you need to shoot your bullets. You may ask yourself, do I have any bullet to shoot? Yes. You have your skill. You have your education. You have opportunity in the economic sector, the equity, the venture capital, consumer goods area. For example, distribution of consumer goods may be an area. I met one startup business in Kenya. I met that woman and I asked her, what are you doing? This woman, she developed an app with some youth from the University of Nairobi, and they use this app to connect farmers planting tomato in different parts of the rural area of Kenya. And then she used those apps to link them up and to develop centers where they collect tomato. As we speak now, this woman exports tomato around East African country and export tomato to the US, export pepper to the US. And she use container. Actually, she take a whole container or 2 containers and export to the US. And now she has close to 30 staff as of the last time I spoke with her. So this opportunity, we have opportunity in the tech industry, agri tech, fintech, clean tech, medical technology. We can convert the challenges around us to opportunity. For example, we talk of poverty in Africa. There is this thing called jackpot syndrome, or people want to escape Africa and move to Europe. Meanwhile, you know, I once was at the Ministry of Interior in Kenya. I've been at the Interior Ministry in Tanzania, in some African country, and I see a lot of people from Europe, from the West, coming to those ministry. They either want to take citizenship or they want to naturalize so that they can start something. Then what I begin to think of is that why is African youth moving out and people from the West are coming to Africa because they want to set up something in Africa? For example, I was in Zanzibar some 2-3 years back, and I met some startup business there. For example, some of them are in the development sector, the real estate, and they set up Fumba Uptown Living, and so many other Uptown Living, and they are converting that Zanzibar environment completely. Indeed, I spoke with their minister in charge of investment and all those things. Within a space of a year, they got over $3 billion investment into Zanzibar. Then I begin to say, what is so interesting about Africa that people from the West and people from the East, that's the Chinese and the rest, they want to come to Africa, and African youth are living. So we need to begin to look differently and look at opportunity that we have in our continent. So in terms of coming back to this picture, which I showed you in the beginning, so we need to begin to ask ourselves, what can I do? Where do I fit? And how do I make impact? You may think you don't have that capacity with you until you start. So these are some of the example of area we can interface also that I put down there. But I saw this interesting quote, which said, effective people are not problem-minded. They are opportunity-minded. They feed opportunity and staff problem. You see, you want to contribute, you need to look at how you can contribute. So in rounding up, I look at this picture. I just pick it late this afternoon. What are the key top 20 startup company, startup countries? If you look at the list of the country with the highest number of startup countries, there is no African country there that I can see. For example, US alone has about 3.56 million startup in 2023 alone, followed by China, UK, and all those things. My challenge to us is that what can we do to begin to get Africa to become part of this? And the solution lies in your hand, lies in my hand. Because in terms of, if you look at the global youth population, Africa is actually leading. So that means we are underperforming currently, and we need to begin to change our mentality. So these are the references to the presentation. I'm sure if you are in the academic and you want to connect with them, you can read more about this. So thank you once again for giving me this platform. And I would like to stop here. Thank you.
Thank you very well. I don't know. Thank you is just too small. I wish there is something else I could use to appreciate you for the work you put into the presentation, for the effort. Thank you very, very much. In the first place, for agreeing to attend. I knew what it took us to make it possible. Thank you very much. Really appreciate your presence. And one more time, we are not disappointed. And I think this is too much for us to digest, but I will go by, giving a little bit of a recap, like picking some highlights and telling you how we can proceed moving forward. So I think we all understand the concept of One Health and One Health action better now. There were lots of pictures in it highlighting like One Health scenarios, what you see and okay, what are the problems with this scene? What can I do to solve it? And I think we are all pushed now, like very hard to really find solutions to the problems that we see around us. Solutions to access to healthcare systems, whether human or veterinary, solutions to food, sustainable agriculture. We are all pushed now. We know what exactly we need to do now. As he rightly said, I'm going to send the presentation to all participants, especially those that have attended, because we had more numbers that registered. And you will have it as your Bible, your One Health implementation Bible that you can use. Now, we envisaged this while planning for this event, that okay, our first presenter, I mean, is the alpha of it, and he's going to charge us to take charge and pick up these opportunities. How do we then present the guide to people that want to do the innovations themselves, people that want to create businesses? And that is what leads us to our first keynote speaker tomorrow, Dr. Shehu Shamsuddin. He's going to tell us how to create a green business, how to incorporate people, profit, and the planet into your business, your innovation, or your startup. So you see, you definitely want to attend our next year event. So thank you very much, sir, Professor Fashina. We really appreciate. I'm not seeing any question in the chat box. Are there any questions for him? Because you said everything. So from my point, I wouldn't assume there should be any question, but of course, if anybody wants to ask any question, please just type it in the chat box or raise your hand. We can please send appreciations to Prof. He really did a great job. It's not easy putting all of those together. And we can promise you, sir, at OHIA will definitely be using your slides beyond this point. We use it in some of the capacity building materials we are developing. I love the fact that you took the time to explain transdisciplinarity, because our One Health Education Working Group is actually working on transdisciplinary One Health courses for early career professionals in Africa to start with, but we want to do something for the South Americans as well. And I think, yes, you've just helped us a lot. We'll also be consulting you on that when we get to the stage where we need your attention. And we hope that you will be there for us one more time. So thank you very much. Really appreciate. And I think, to also save time, we can then proceed to the next presentation before we then go for a panel discussion where everybody can pause and talk. So our next presenter will be talking specifically on, well, I said at the beginning that I am now a wildlife vet and is going in the wildlife direction now. So I'd like to invite Dr. Samuel Akpan to present. But before then, let me introduce him to you. He's an epidemiologist and an early career researcher. He says he's an early career researcher, but if you look at his achievements, I wonder what his late career would look like. So he's a PhD candidate currently at Wageningen University in Netherlands. And he's also a doctoral research fellow at ACEGID. ACEGID is African Center for Excellence for Genomics and Infectious Diseases in Nigeria. And also a doctoral researcher at One Health Center for Africa, HORICA, at International Livestock Research Institute, ILRI in Kenya. So he's an alumnus of Sustainability Center at the Lagos Business School, and he has received 2017 African Young Water and Sanitation Professional Research Grant, right? And he has close to a decade, 10 years, where we are still learning of experience in field epidemiology and research. And that is the person that is presenting next. You don't want to miss a word in the next presentation as well. Dr. Samuel, the floor is yours.
Thank you so much, Dr. Dauda. Can you hear me?
Yeah. Yes, loud and clear. We can hear you.
Okay, thank you so much. Well, I feel this is a setup when I saw the schedule. How can you ask me to speak after Professor Fashina has spoken? This is a setup. But then we will try. Thank you so much, everyone, for attending. I must commend One Health in Action Initiative for what he's doing. And I must say I'm proud to be associated with this initiative. So without wasting much time, I would go ahead to share my screen. Okay. Can you see my screen?
Yes. Yes.
Okay. Okay. Yeah. So I want to have a talk about the sustainable use of forest resources in reducing zoonotic spillovers while also ensuring conservation and livelihoods. So in starting, I'll be talking about the three key terms that is there, which is zoonotic spillovers, conservation, and then livelihoods. And then I'll try to give an introduction. We'll take you through the current realities, what is happening, and why is this discourse very necessary. We'll look at the drivers of all the things that are happening and why they're happening, and then we'll look at how to chart a way forward. So I actually wanted us to look at this zoonotic spillover because a lot of people mistake it with the normal zoonotic diseases. Zoonotic disease, for example, is a disease that is transmitted from an animal. It's a general term. But when you say spillover, it has to be from a wild source, a spillover. So it's a cross-species thing, and then it can be a solo event from just one animal to the other, or it could be an event, a cascade where from a particular host to another host where the pathogen is modified, and then to a human, or through a vector. So the next key term would be conservation. This is just basically presenting a wasteful use of a resource. So sometimes you can interchange conservation with sustainable use, with preservation. But in this context, we are actually looking at how to protect species from extinction, how to restore habitat, and then enhance the ecosystem services. So most example of the ecosystem services we are talking about is wildlife, forests, water, and biodiversity. And then livelihoods is just basically a means of living for people. Example, farming and all of that. But in this case, we are looking at livelihoods that are connected to forests. And then livelihoods, like Professor Fashina just said, is gender sensitive. We'll look at that as we proceed. So, forests play a very vital role to support food security and livelihoods in Africa. Now you can see that this forest where you can see 4 parts. These are just tire parts showing that there is an anthropological effect on this forest because people are going in. But why are people going into forests? It's basically for agriculture, for harvesting of products, and for things like mining of wood. So forests are basically exploited for food, for fuel, and other marketable products. Other people that are involved in herbal medicine, they also patronize forests to get medicinal herbs from trees that can support human health. And a lot of veterinary medicines also are increasingly being gotten from medicinal plants, a lot of the medicines that are being used in the animal sector. Now, an estimated 22% of the area in Africa has been lost. You can see these pictures. There's a forest burning here. Most of the time when this happens, you see that people were trying to farm close to the place and they're trying to burn the bush close to a forest. And then the forest fire just escalates and then goes into a forest. And people feel that there is nothing wrong with this. After all, it's just a forest. But today we learn that forests are not just forests. Forests are very important for the One Health thing, for survival of humans, animals, and even the environment. So indiscriminate use of forest resources have been contributed to zoonotic spillovers that have led to concerns on how do we balance the ecosystem. For example, when we talk about Lassa fever, for example, which is an issue in Western Africa, most especially, we say that the multi-mammate rats are responsible, right? But then we encourage people to see, okay, can we limit, can we kill mosquito, you understand, those rats, can we trap them, can we do? But that calls into question, do we conserve forest resources, which includes wildlife, because we want to end diseases, because we want to track diseases? That's a question for you and I. So you can see on the right-hand side, this is already a Bay Area, the effects of the fire. Now, these are the key spillover pathways, and this basically happens from where my cursor is, maybe from, let's say, from the middle area to the left, basically happens mostly in the forests. Now you have the pathogens on the left-hand side, the fungi, your bacteria and your virus that are in the monkeys, the bats. Now, these pathogens undergo various processes. You can see that there's gene recombination going on, there's amplification, there's mutation, there's morphological alteration. All these go on in these reservoirs that are in the forest. And then there is a spillover. Remember the definition of the spillover I gave, there's a spillover to humans, either through contact or through activities. Now, this is a work that we try to see the last 20 years, how have indiscriminate use of forest resources affected human beings? How have it led to spillovers? How many diseases have we recorded? So you can see here that in the last 20 years, mostly we have about 8 diseases that have been reported, 8 spillover diseases in the last 20 years. You can see the frequency. You see Ebola was there in 2022, and then 2023, and then a little bit in 2024. You can see that. You can see the spread of Ebola almost every other year, almost every two years. The only space I'm seeing here for Ebola is between 2008, 2008 and 2012, and then 2024, it came back again. And then from 2016 to 2020 or thereabouts, it was maintained. And then you look at the spike of monkeypox in 2016, and then it went down towards 2018 to 2019, and then has been maintained through 2020 and the likes. These are just one of the current status that we have because of some of the things, some of the indiscriminate use of forest resources that we are talking about. Now, we went on from there to look at what countries have been affected. Look at the spread, where you have the green area as the countries that have been affected. 34 out of 53 countries have been affected. And we believe that there is more, because when we're doing this work in this review, we considered more articles or reports that were done in English. So it shows that we didn't actually capture the northern aspect of Africa, Morocco, Algeria, Libya, Egypt, and then some part of South Africa. But you can see that a large portion of Africa has been reported, there has been spillovers because of indiscriminate use of forest resources. Now, what are the drivers? We are talking about indiscriminate use of forest resources, sustainable use of forest resources. What are the drivers? We'll look at land use change, wildlife hunting, research, and human-animal conflict. Now, there could be more, but these are the major ones that has been identified. So, land use change, what do we mean by land use change? Land use change is when you utilize a land for purposes other than what it was meant for. That is my own big definition. For example, like the picture that we see down here, they're trying to make roads, okay? Civilization, modernization, they're trying to build roads, and then you go into a forest, and then this was a forest area before now. And then you're trying to put in tractors there and heavy equipment to try to bring in sand and grade a road and make way for people to pass and all of that. This is good, but it also has severe effects on the ecosystem. It has severe effects on human, animal, and environmental health. Now, deforestation, like you see in the picture up here, alters wildlife communities and modifies human-wildlife interactions by increasing zoonotic spillover potential. Now, when human beings go into these places, don't forget there are wild pathogens in these places in wild animals. And where do you think the wild animals that were living here, where do you think they are? They've tried to go into the nearest households. They've tried to move in closer to where human beings are because their natural habitat has been destroyed. Now, this is part of the reasons why the pathogens are moving closer to human beings. So forest land utilization for roots, housing can stay pathogen spores. For example, in the last anthrax cases that have been reported, we see that from the studies, from the reviews that we are doing, that anthrax spores can survive in the soil for many years. Now, this kind of work that is being done here, trying to create a road, can actually stir up pathogen spores. There can be erosion that also stays up pathogen spores because the topmost part of the soil is being removed because the forest cover was removed, it wasn't there. So this is how deforestation can lead to spillovers, because the natural ecosystem where the pathogens were, and they were just there, they were not having issues with the animals, they were just carrier animals, are now spilling into humans because of these anthropogenic activities. Now, the nitty-gritty, wildlife hunting and consumption. This is one of the main reasons, besides from the land use change. It's an age-long practice where people consume wildlife, but then Prof just talked about livelihoods. This is one of the this is one of the livelihoods that have lasted long in Africa. Wildlife hunting. People trade pangolin scales, people trade monkey claws, and people also consume wildlife. Now, it's mostly supported also by cultural beliefs because people use body parts of animals for different things, for cultural festivals and for zoo therapy, which is some people utilize, let's say, python oils for maybe healing. Traditional herbal medicine people utilize some of these things for healing people or for medicines. However, wildlife hunting predisposes us to new pathogen evolution, like the description that we saw, how pathogens that were commensals of a particular animal is now moving into a human being, and there's an evolution that occurs. Now, this ends up, for example, for bacteria, it ends up in antimicrobial resistance because the pathogen has evolved and we no longer know what particular variant it is. So when you take drugs and you think, okay, I had this headache, I had these chills, and I'm going to take drugs in order to be able to cure, then that antibiotic is not effective because the pathogen has evolved. So part of the bushmeat hunting is, look at the processing that is going on here to your right. This is actually a woman processing a snake. This is a snake. The other part has been cut off. Look at the fact that she is holding this snake with her bare hands. That's a knife down there. She was just processing, trying to cut it so she can cook it for her customers. This was actually someone who trades in bushmeat. Now, imagine the viral load of this snake, for example. Imagine the fact that she is using her bare hands. If she is having any sore or any part of her hands loses, the skin loses the integrity, or there's a blood contact, that's a direct infection. Now look at the right-hand side too. This one is also cut. It's basically the same thing. Look at how she's holding it close to herself and processing and all of that. So these are typically animals that were far away in the forest, and you're bringing them closer to yourself, and you're holding them like this, and you're not wearing gloves, you're not wearing anything, and you're eating them. And I mean, another bad aspect of this is that bushmeat hunting, you understand, leads to wildlife extinction. Because when you keep hunting grasshoppers and the rest of them, over time, they're going to go down, and then, because from a recent study we did, we found out that pangolins are gradually becoming very scarce, even in West Africa. Pangolins are scarce. Dig-digs in Kenya are becoming, people are no longer finding them as much as they were doing before. Now, let's go to another driver, which is research. Now, to your left, you can see there's a bat. A researcher is trying to process a bat right here, probably for sentinel surveillance or viruses and all of that. But for this researcher to be able to do this, the animal had to be sacrificed. This bat had to be sacrificed. It's killed. To your right is a squirrel. A land squirrel is being dissected to be able to harvest the liver for studies. You find out that most of the studies that we do, you will need up to maybe 50 animals, 20 animals. Sometimes they do a cross section of 100 and something animals. Now, this raises ethical issues because we are not able to conserve most of them, and we are bringing them closer to ourselves, and we are killing them because we are trying to do research. Now, with these pictures, I tell a little story. This happened right in Nigeria. To your right, you can see people are sitting on a forest elephant. This is somewhere around Ogun State, where we call the Omo Forest. Now, because human beings were going into the forest to create farms and plant cocoa and the rest of them, you have these elephants straying into the forest. Can you still hear me? Sorry, am I still audible?
We can hear you clearly, Dr. Akban.
Okay, thank you. Now, there was a conflict because this elephant strayed into a farm and attacked one of the farmers, and the farmers, some of them grouped, and then one of the times the elephant was coming back again, one of them shot this elephant and he died. Do you know what? Animals are also very intelligent. Now, there were 100 elephants in the Omo forest. Now, let's look at livelihoods. People visiting Omo Forest and wildlife parks is also one of the ways to raise money, also one of the ways to raise funds for income and all of that in terms of tourism. Now, these elephants, they were so angry, I would put it at that. They grouped together and 100 of them have migrated to a place called Itaoshin, just at the boundary of Lagos and Ogun State. The elephants have migrated. If you go to this Omo forest now around where we call the JP4 area forest reserve, you won't find them because they have migrated. And the area they are migrating to definitely has more human beings than where they were, because where they were was comfortable for them. But because of human-animal conflict, they have migrated. Now, with all this we've said, which way forward? What do we do? How do we manage this? How do we use the forest sustainably so that we can avoid spillovers and also ensure that the wildlife biodiversity is conserved? Now, we need to do reforestation. Now, in as much as we are creating roads, there is civilization, and we are building houses, we need to be able to find a way to estimate deficits. Okay, this is an area where logging has really been done, okay? Because there's a lot of logging going on in our forest right now. This is an area where logging has really been done. Can they actually be replaced? As they're logging a particular area, can we replace over a 15-year period? Can we replace these other areas so that we can still have our forest cover? Or can we, as we are logging, can we be replacing them immediately? Can we put more forest where they were not? Can we even replace them where they were before? Okay. Also, can conserved areas also be avoided? Because there are areas where we say this is a conservation area, but in Nigeria, where I come from specifically, I'm using that as a case study, you find out that more of those conserved areas are gradually being cut off bit by bit. They are chopping into it, they're selling it to people, they're making roads that are passing through a large forest, and before you make roads, you know you have to do a lot of logging. The forest covers are being lost, and most of these wild animals are moving closer to human residences. Now, the second one would be to control hunting. How do we do this? Now, since we are trying to create a level play between livelihoods and sustainable forest use, the question would be, like I saw one of the write-ups by One Health Initiative, an action initiative, was, I think last month, was that a question If we are not going to eat bushmeat, what do we do? If we are not going to hunt bushmeat, how are we going to get money? Okay, now there is another way of doing it. For example, since we have a large proliferation of African giant rats and the mastomys rats that cause that harbor Lassa fever, we have a lot of them proliferating in areas like Ebonyi State, like Irua in Edo, like areas in Owo and the rest of them. Can we target using the IUCN? By the IUCN, I mean International Union for Conservation Network. Can we target species that proliferate a lot, that are highly prolific, for example? That's number one. For example, we can say we just want to, okay, for this period, for this area, concentrate and hunt grass cutters. You are using it as a way of the population of their large numbers, because grass cutters can give birth to at least 12, sometimes 10, yes, at a time, sometimes even more. So these numbers are proliferating, porcupines, but especially more of mastomys. They can give birth, they are highly prolific. Can we say, okay, control that, just hunt this and leave this other larger animals alone? Also, seasonal considerations are very necessary. If there must be hunting in some of these areas in order to bring down the load of some of these animals that have been implicated in zoonotic spillovers, can we hunt seasonally to sustain livelihoods? Because in the rainy season, most of the time, you find that most of these animals, this is their breeding period. Can we allow them those seasons and then hunt them at other seasons? Okay. Now, the next one would be to adhere to ethics. We have to follow ethical procedures in research. The world has moved away from you wanting to do research and then you are bringing in 100 grass cutters and you're sacrificing all of them because you want to harvest the liver, because you want to harvest this. There are ethical ways of taking, there are alternatives. You can take blood samples, or you can take scrapes, or you can take fecal samples, but we need to start engaging in capture and release and forest replacements. We need to keep doing this. We cannot keep killing and killing because we are researching. Now, and then we need to discourage wildlife trade. We need to enforce sanctions more. We find out that in our conserved areas, we just talk about it, we just keep talking about it and nothing is being done. We need to place sanctions on the hunting of particular species that are going extinct. Example, pangolins. I watched a video the other day where the forest conservation agencies were burning pangolin scales that they had discovered. More than 20,000 tons of pangolin scales someone was trying to ship them out of the country. Now, for the pangolin scales to be gotten, that means they must have killed over 14,000 pangolins to be able to generate that volume of pangolin scales. So we need to encourage more of this, discourage more of this thing. Now, for those that are relying on forest resources for survival, for their livelihoods, can we begin to provide alternatives? This is more of a policy talk now. Is there something that the government can do to look at these communities that rely on wildlife as their major source of protein? A lot of people cannot afford to buy other livestock, so they rely on these animals for their livelihood, for food and for sale and all of this. Can we begin to engage the youth more? That is why tomorrow, I think Shehu Samson is just going to do justice to more of this tomorrow in terms of the livelihood aspect. So in summary, this is all that I've been talking about in one picture, that sustainable forest use is also a One Health concept. Many people do not know this before now. We keep talking about animal health, environment, and this is a core environmental aspect that we're talking about. Look at what sustainable forest use is holding 5 major things. It can help us conserve biodiversity. It can help us sustain livelihoods. It can support a safer climate. This is what I did not even mention today, because the forest cover is also a very, very good sustainability concept. you know that forests they give out oxygen, okay, and then they take in, so they make the environment comfortable. If you find yourself in an area where you have much forest cover, in those areas, you find out that they serve as windbreaks. A lot of climate change effect does not really happen in areas where you have forest covers around or closer to them, because the forest also helps, and then also it helps in sustaining animal health. So this is this, and then I just want to say thank you, but I won't leave without saying thank you to my host, African Center of Excellence for Genomics of Infectious Diseases. I will also thank Oreka for One Health Center in Africa, domiciled at International Livestock Research Institute, Kenya. I want to say thank you to the German Corporation for International Development. And I also want to say thank you to Alliance Against Health Risks in Wildlife Trade. Some of the things I've said today have actually been things that we have been involved in, and most of those pictures we've taken because these agencies here have really supported us to be able to do this. Thank you very much.
Thank you so much, Dr. Sam. Like, you are hitting the nail right on the head. And so we are now boiling down to specifics. Now, when it comes to, in the beginning, when I introduced the event, the first case scenario I mentioned was hunting and bushmeat consumption. Now you see what I am saying. Those are not sustainable ways of getting animal protein, right? We need to switch over to alternatives that are more sustainable. There is livestock production there. We hear so much about that one tomorrow. Like you said, we have the kings, the people on top of the pyramid for that one coming tomorrow to tell us so much more about it. Thank you very much, Dr. Sam. Now is the part that reflects the theme of the conference, African Youth Dialogue. It's time for everybody to talk. So before we go into the panel discussion, we'll be taking questions for Professor Fashina and Dr. Sam at the same time. So if you have a question, you can type it in the chat, or okay, somebody's raising Dr. S.O. Ochai, all right? You can unmute yourself and speak. You've been allowed. So you ask your question and tell us who you want to answer it. Shortly after that, we go straight into the panel discussion and everybody can raise their concerns. We want everything to come in. This is basically just the baseline for subsequent actions and dialogues. Like we said, this won't be the last. So I'm seeing two hands up. So which I please unmute yourself and speak. Let me know if you're unable to do that. Okay.
All right. Thank you, Samuel.
Yeah.
Can you hear me?
Yes.
No, I want to first thank the speakers for such insightful presentations, and also to my boss, Prof. Fashina. He has been my boss since so many years ago. So I want to just use this opportunity to say hi to him. But then I have some comments or some things that might require clarifications, especially for the second speaker. So the first one is about the issue of using firewood, for example. So in most rural areas, the reason why people use firewood from so many research that we have seen, especially in Southern Africa, is that people use firewood not because of how expensive other alternatives are, but just simply because of cultural beliefs. So there was a study where we realized that, in fact, we went for a community engagement activity and we spoke to rural dwellers, trying to shift their mind from using firewood, especially around the Kruger National Park in South Africa. And they mentioned the reason why they use firewood is because whenever they cook with firewood, it tastes better. So for such people, how do you convince them to say, no, you can stop using firewood and use maybe a kerosene stove or electricity if they have that? How do you convince such people? And then the second thing is you mentioned about seeking other wildlife that proliferate faster. And I actually find that a bit a bit disturbing in the sense that with the increasing number of humans, there will also be a lot of pressure on that species. So I wanted to ask, instead of shifting to another species, is it not better to switch to, if the community is so interested in consuming wildlife, why not we switch to wildlife farming as is done in other climes? I would like to get your feedback on that.
Okay, thank you very much. I guess you're from Kenya or China?
No, no. I'm from Nigeria, but then I've done some
Okay.
work in Southern Africa.
Okay, thank you very much. So let me start from that last concern. Now, rearing wildlife has ethical issues. There are ethical concerns to it. Though it looks really nice, but there are ethical concerns to it because wildlife is supposed not to be captive. Rearing wildlife means you're going to have to build a place for them and try to control them in such a way that they are not moving out of that place. And then welfare concerns, because at the end of the day, you are planning to kill them. We are looking at sustainability, making things more natural. Okay, so that's a concern with trying to rear wildlife for consumption. Now, why I suggested the moving to wildlife that are proliferating more faster is also because you're trying to kill two birds with one hand, with a stone, because while you're still, okay, waiting for the government to say, okay, we are going to move these people, we are going to provide alternative means of proteins, you're not, the human aspect is that it's not easy for you to convince people to leave what they have been doing. The highest you can do is to see how you can move them to safer alternatives and just keep moving to safer alternatives until there is a definite solution to this issue of wildlife consumption. Because, for example, I did give an example where Mastomys rats are proliferating so much in certain areas in rainy season, especially around rice fields, swampy areas of Edo State, Ebonyi, some aspect of West Africa, and all of that. And then you need to really, when you're also targeting control of diseases, you also need to target the vector in the wild. Now, what are we going to do about this? That's one. Then two, I'm just attempting to answer the questions. Others can also make their own contribution. In the aspect of using firewood to cook, I think it still has to do with stakeholder engagement and then the willpower of the government to be able to see how they can subsidize and make other alternative means more conducive for the people to be able to afford, because definitely people love to cook with firewood more and more because they say the food tastes better and all of that, but those are just cultural beliefs. Trust me, if human beings have better alternatives, they will move. So convincing them is not an issue. The issue is that we do not have better alternatives now because kerosene prices, petrol prices, and the rest of the implement they need to use is on the high side. And then they have wood, which is natural behind them. So why won't they use it? So this has to do with the government looking for more proactive ways of crashing down prices of certain implements so that our environment can be conserved. Over.
Sorry, can I just comment on that? So
Okay.
in that same study I was talking about, the government actually provided alternative stoves for the people at subsidized prices, but then the people were not using them. That was what necessitated stakeholder engagement. And then we realized at that point that the cultural belief was more important than anything to them. So it is not about alternatives. If you are going to provide them alternatives, you have to provide them what will be almost similar to what they are getting from the firewood. So what we decided to do, we realized that, like Prof mentioned earlier, is to bring in the social scientists that we're able to bring the social and behavioral change component of it. And then even though when I left, that process is still on, because we realize it's not something that can happen just overnight. It's a behavior change. So I think for most people, it's not necessarily, in some places I agree with you that it's because those are the cheap alternatives, while in some places it's more cultural than economic.
All right.
Thank you so
Thank
much.
you very much,
Thank you.
Eso Wocha. That was a very nice question and input. So, well, I'm also in the wildlife space now, so that means I would like to, chip in a little bit. So there are two things I picked from this, like two things that are very important. Number one, the involvement of government. Yeah, so government has to step in a way that will I'm not saying being forceful, but a very proactive manner, such that the people will understand that this has to happen. We have to move from heavy use of firewood to some other means, right? So in that, if government is really serious, or if they really meant to do something, they can collaborate with foreign agencies and donors and subsidize other means of energy generation or power generation or fire for their food and everything in that particular area, at least for a length of time, until it becomes a norm in that place. So that can also aid the behavioral change that we are looking at. That is one. Then secondly, all of this we are talking about, we don't mean, sometimes it's not possible for the change to happen suddenly, instantly. Although, yeah, we understand that, okay, we are at a point in the globe where the climate change, environmental sustainability is an emergency. But if we are dealing with a population, a human population, that is so difficult and it's so impossible, so to say, to change their ways in doing things, we can look at reduction first before elimination. So, and even if you employ an approach that would put an halt to it, it's not as if it's just going to come to an halt instantly. So we look at reduction first before elimination. Now, for reduction, on this specific example, this specific case of firewood, so they can still use firewood, but lesser firewood than they are used to. There's a stove now that is being constructed, because I was at the conference recently, and one of our partners in Ivory Coast mentioned this as a problem. So they are going for this reduction first, and the reduction method they employed is there is a stove that is designed to generate more heat, more firepower from fewer firewood, fewer biomass. So you use less biomass to produce more energy for your cooking and whatever you need it for. So in such places, you can introduce those systems like the reduction before you now go for, okay, I mean, if they can embrace the stove, I think they would also look into, okay, yeah, if I can be more efficient with this kind of stuff, use less of a, okay, maybe this is better, maybe this is better. You have to induce that doubt in the mind of the people before you talk of now changing them. So, and that will be all. Thank you very much. Any question for Professor Fashina? I'm expect Tesfahun from Ethiopia. Please go ahead. You can unmute yourself and speak. Ask your question.
Okay, I hope that I'm audible.
Yes, you're audible. We can hear you.
Thank you so much. First of all, I would like to thank Dr. Daula for scheduling this opportunity for us to collaborate. And the second, thanks so much for Professor Fasuna and Dr. Sam, since these types of opportunity and collaboration with each other in dialogue conference and different symposium in One Health empowers from grassroots to national or global level. And so that, thank you so much. And I have two questions. The first question is for Professor Fasina. That is, most of the time, most of the time. For improvement or advancement of one healthy, it need to be done in a rural community as well as an urban community. But most of the time, resource mobilization and resource allocation are most of the time at the center or centralized. But the real challenge or the main challenge for One Health is at grassroots, especially for rural community, so that in today's world, how we can overcome this. Since I know more of the experience about rural community, since I'm in rural community, when I compare the action of different organization, whether local level organization, national level organization, or global level organization, no more actions are done as a story when you compare from the past. It's no more action is done to ensure One Health in rural community. I know that the action is also not mostly fulfilled for urban, but there is a great difference between for urban and rural. So how we can overcome this challenge for rural community? This one is for Professor Fasna. The second question is for Daula, as you are executive director or the founding of this One Health Action Initiative. I am eager or interested to hear from you your story of achievement. I hope that you started from grassroots and you reaching to Africa as well as globally. So your sharing of your experience empower like us and other veterinarians to do more in their community as well as in their nation. Since I tell to you my story last year when I trained and certified as UPG sustainability leader. I have a project on One Health at grassroots. I proposed and done all my assignment as it need to be done for one of assignment in sustainability leadership program. Then paperwork, after finishing paperwork, I search and seek for different groups of community or different individual for collaboration. But at the time, I hadn't got someone for collaboration and much more. Then after, I'm no more doing practical application rather than making awareness on social media and Facebook, LinkedIn, and other platform. Beyond that, I'm not done everything practically. So I need to I need or interested to accept your experience or sharing your experience for your achievement. That's thanks so much.
All right, thank you very much. Deeply appreciated. Prof, your question came first. Would you like to go first?
Yes. Yeah, thank you very much, Teswe. I think your question is very apt. And you know, in my concluding remark, I mentioned one of the experiments we carried out in Kenya, wherein we know that normally, because of the structure of the governance system, typically when international donor agency come, they have to speak with the national government first. And then from there, they will plan on how to integrate development into the country. And this is why, in most cases, you see that most of those funds also are centralized, which, as you rightly pointed out, is not supposed to be so. Because at the front line, at the people level, is where the real action is taking place. That's where you have challenges. That's where you're having the disease. That's where you're having action that need to be taken. So one of the things you need to do is that the national government need to begin to think of whole of society approach to designing program. And that is why I mentioned this issue of co-creation. Like that particular 5-year development plan we did for Kenya before I left Kenya, we actually bring about 60% of all the participants from the rural area, including from pastoralists, including from community leaders, faith-based leader, the local government officials, and then the remaining 40% were from between the academia and the national government. We have protestation from the national government, I must tell you, and every change, definitely we attract protestation. So the national government felt, no, you cannot push our program and push it to the front line. But we said, well, these are the real people with the real issue. And through that approach, we were able to design a program that now fits into both the rural and the urban. And for example, the national government will be more interested in maybe having meeting at fancy hotel, designing new document, designing new program, and all those things. Meanwhile, the front line wants something that can bring action right at the front line. So you have to look at it that way. And so we were able to bring in that one. And we also brought in our development partner into the program. So USAID was in that meeting. The Fleming Fund was in that meeting, and a few others. And they saw clearly that, the action actually need to be happening at the front line. So when we were putting together the list of new program we will carry out for 2022-2023 year, the USAID insisted that where are the program that you want to do at the front line? They want to see it in the list of program we've designed. So we have to show them this one goes to the front line. And in terms of capacity development alone, we assigned over $100,000 to train people from the front line using the eServet program. So these are some of the things you need to begin to push. I know it's a difficult discussion, because as you push, the people at the national and central level want to push back. But it's an ongoing discussion that you need to keep pushing on, and we hope that they will buy in, and then you can have some action taking place at the front line. Thank you.
Thank you very, very much, sir. I will narrate my experience in terms of one implementation, then we can proceed to the panel discussion. Our panelists are bothering me already. They want to step up. All right, so Tesfaun, presently, One Earth in Action initiative is very young. We don't have a track record of like physical engagement yet, but from my personal experience, I can share a few tips with you. So before you commence, when you're in an area and you're looking at a problem, you have to be very specific. You define the geographical location, and then in defining your problem, do not assume people's problem for them. Yeah. So in defining your problem, it has to be people-centered. You have to ask them. For example, if water is the problem in a particular place, you have, okay, what are your sources of water? Why do you like getting water from these sources? What are the alternatives? Why you using them? And so that you get to understand what solutions. From there, you can also get to understand what solutions will work and will not work. What is it that they are willing to admit before you do it? Because the One Earth itself is collaborative. Collaboration is one of the pillars, right? So you don't design solutions to problems that you think about in your head. You design problems to solutions that are from the people. So you work with them at the point of identifying the problem and at the point of creating the solution. So when in working with them, you'll be able to pinpoint the stakeholders, because most of the time, from a personal experience, when you engage people on a particular problem they've been facing, the trend is at some point to come out, or when you ask, okay, has anybody tried to do anything, then they will tell you efforts that have been made by the government, by NGOs in the past, and they will try to even tell you to the specifics, this is exactly what they do. So from there, you now know, okay, what failed in the past, or what succeeded. So that is the beginning of the whole process, right? So when you've now mapped out the stakeholders, when you've identified the problem properly in a baseline studies or a baseline participatory approach, then you move to co-creation that Professor Fashion has said. So you now sit down with the stakeholders, and then you make your proposal of, okay, this is the solution we want. How do you want it to look like? What are the modifications you want to it? How do you want it to suit you? Or do you have other alternatives? That way, people will accept whatever One Health solution you are bringing, and you're carrying them along, which means you're also inherently implementing One Health in your efforts to really create a solution to the problem. So then the third phase, in execution, you also have to carry them along. If they give you ideas on how to solve the problem, you don't go behind them solving the problem. Then when you, because ideally it's a cycle and you have to reiterate multiple times, most of the cases. So in the first completion of the cycle, let's say, okay, rabies now, let's say rabies, for example. You went to a place, they told you, okay, when our dogs get the vaccine, they do this and that. And then you come up with a plan eventually. The first round of vaccination you do in that village, you have to amplify the efforts of the people that participated. Yeah, the early adopters, the people that helped you to design it, the part of the community, the stakeholders. You have to like make announcement and make sure you invest properly in amplifying their efforts. So that will attract buy-in from more people and more stakeholders. And then, yeah, you attract grants from agencies and everything. So don't just do whatever you do and believe, okay, because you're taking the action, you're doing the work and you keep quiet. You should also make noise about it to attract traction to yourself. That is like the thread, the overarching way to put it. It's very generic, I know, but if you have a specific problem at a particular place, then we can talk about the specifics as to, okay, how to engage which stakeholder, possible challenges in engaging what category of stakeholder. I believe I've answered your question, going by the fact that we are in a webinar and we can go down to the specifics, but subsequently, I can promise you, our intention is to come up with, from the input we're getting from this meeting, come up with sessions like webinars and other things where we can discuss this kind of specific issues further into details. So thank you. Now we go to the panel discussion. On this one, it's the floor is open. When we throw out the question, if you have an input, just raise your hand. We'll take 2-3 people. And once we discover, okay, maybe we're wasting too much time on one question, then we move to the next one. So try as much as possible to be as succinct as you can, be precise, just make your point and let it go. We are like 2 hours into it now and everybody's tired. So I will now call on the moderator of the panel discussion, Dr. Sharifat Baloguraji. She's ready for us and she just wants to jump in. She's angry that we've taken so much of her time. We are very sorry about it.
No. The conversation has been absolutely mind-blowing and insightful. I particularly enjoyed Professor Fashina's insights into this and some of the brilliant solutions he had for Africa. There's so much to do, so much challenges along the line. But we as Africa have been known to be resilient and we just have to keep at it. So my name is Sherifat. I'm a veterinarian and a One Health researcher and a pharmacologist as well. Today I'm moderating the panel session and I have questions that are divided into 3 parts. The first would be questions geared towards careers in One Health development, while the second would be on building socio-economic resilience in Africa through community engagement. The third would be what are the things we could do in terms of advocacy and resilience. So for the panel session, I have 3 distinguished guests. I have Dr. Yusuf Alimi. Could you indicate if you are in the room, Dr. Alimi?
I don't think he's here.
Okay.
Yeah,
I also have Dr. Samantha. All right, thank you. I also have Dr. Samantha and Dr. Sahad. Please let me know if you are here so that I could ask.
Dr. Sam is here.
Dr. Sad?
Dr.
Okay,
Sam,
Dr. Samantha. Yes.
Yeah.
Yes, thank you very much. So, Dr. Samantha, your questions are questions related to social economic resilience through community engagement. I would like to ask, with One Health in mind, in the context of One Health and sustainable development, what are the things that you think the African youth can do in order to have social economic resilience? And how is that important to the communities that they live in?
Okay. So first of all, thank you so much for the opportunity. This is, of course, an interesting discussion because, number one, we're brainstorming on solutions, and we're bringing in a different perspective as you're brainstorming, and that's the One Health approach. So a
Dr.
medical
Samantha.
doctor, human. Hello?
Okay,
Yeah?
yes, I was going to ask you
Am
to
I
please
audible?
introduce yourself. I can hear you clearly, Dr. Samantha.
Okay.
I was going to ask you
It's
that
okay.
I forgot to tell you to introduce yourself to our guest. So please, could you introduce
It's
yourself
okay,
and go ahead with my question? Thank you.
Okay, sawa. Sawa just basically means okay. So my name is Dr. Samantha Mkonja. I work in Kenya. I'm a medical doctor working in a rural, but I could say semi-urban part of Kenya. It's practically Kakamega, which is a huge, falls into the Lake Basin region of Kenya. I am extremely passionate about health solutions and particularly looking at it from the broader perspective, because as we all know, because of the complexity of knowledge, a lot of knowledge has been reduced. So we are living in silos, or we are learning in silos. But getting that chance to look at health from a huge perspective, particularly either One Health or planetary health, the broader picture excites me. Yeah, it's always exciting and it's always interesting. So thanks so much for the opportunity, and thanks so much, Dauda and team, for inviting me. So when you look at social economic resilience, it's basically about bouncing back. Yeah. And like you had stated earlier on, Africa is known to bounce back, which is a very, very positive impact. And we're talking about bouncing back in terms of social, economic, as well as environmental challenges that we are facing. And at the same time, ultimately looking at it from a point of health as well as wealth. And like you had stated earlier on, which I've seen is the key theme of this event, is looking at it from a sustainable eye. So to answer your question on what exactly as youth we can do, first is working together. Huge component of One Health is understanding the interconnectedness of life. Like I had stated earlier on, we are trained in silos. We naturally tend to think in silos. So you most often than not will be surprised when a different perspective is brought in, yeah? And that's what we encourage in terms of One Health, is understanding that a lot of things are actually interconnected at the micro level as well as the macro level, and moving away from the reductionist approach. So some of the challenges that are seen are generally what we'd consider wicked challenge. When you're looking at the problem of zoonotic diseases, these are wicked challenges because they cannot be addressed solely by one profession. So putting a team together to work on that. The other thing I feel we can look at, which again is just emphasizing on the theme of the event, is looking at sustainable development. We want to be resilient in terms of our ability to recover from economic shock, not just health-wise, but wealth-wise, like I had emphasized. So as youth, bringing in that perspective helps. Efforts towards environmental stewardship, approaching it from a point of not just checking short-term goals, but also reviewing it in terms of long-term goals. So what will the impact be to this community now and 5 years from now, and a generation from now? And lastly, maybe I can state, looking at it from the broader perspective, like we're talking about zoonotic diseases and impact on health and livelihoods. So as youths, working together as a team ultimately just settles down on having different professionals from both the sciences and the social sciences, different areas, working together to come up with solutions that are able to address these wicked challenges. Thank you so much.
Thank you so much, Dr. Samantha. My second question still goes to you. What are the challenges that you feel the African youth encounters while attempting to build a socially economic, resilient community? And how can they address those challenges?
All right. So sorry. Let me jump in quickly. That's what I do. I'm sorry.
Okay.
So
It's
you know,
okay.
just to just to buttress on Samantha's point before we jump to the next question. So socioeconomic resilience, as she has said, is about bouncing back, right? But from my own perspective, since the other panelists are not here, I will, if I can, become a panelist now. What I think African youth can do whenever there's an economic shock or a planetary disaster, climate disaster that they need to bounce back from, we need to put into perspective bouncing back better. Because even if we use the One Health approach to bounce back to the way we were before, I think there's still possibility that we are going to crash down again. We need to bounce. So how many times do we need to bounce back? So if I would comment on this, I would say African youth should always consider bouncing back better when there's a crisis and they need to step in. So when designing innovations or startups or businesses that revolve around sustainable development for areas that are prone to climate crisis or that are prone to disasters or poverty-stricken areas where people's livelihood are being compromised by an event that is beyond their control, right? We always have to think about means for them to come back, to recover, but recover in a way that they will be stronger when something like that happens in the future. I'll give example of flooding, which happened in northwestern part of Nigeria 1-2 years ago, and it's a recurring problem there. So how do we come back from cholera outbreak, for example, after flooding and prevent it from coming afterwards? So all solutions you would design shouldn't just speak to, okay, treating everybody that has cholera after that, and that's the end of it. No, how do we incorporate hygiene into their lives, and hygiene in a way that is sustainable? For example, if you as an NGO just provide sanitizing agent or whatever for people to clean their hands and do, that is not sustainable. You have to, there are now local hygiene products that you can teach people to produce. So that way they will be incentivized to continue with the production of those products. And that means people will continue to use something like that. So the people that are producing in the community will continue to produce, and they will make money from the sales of it. And people that are buying it will continue to use. So we need that sustained presence of interventions such that, you know, we don't just come back from crisis, we come back and be better, right? So that would be my input on the first question, if it's really.
Thank you very much, Dr. Dauda.
Yeah.
Dr. Sam, do you have anything to add? Because I know you were about to say something.
Yeah, I was actually quite excited because the idea of bouncing back stronger means at the second knock, you're least likely to fall. You get, that's not the actual reality, but it means you're improving. There's something that's happening and you're tracking towards a certain direction. So thanks so much, Dauda, for that. I totally agree. And then the point that you said on developing solutions that are actually sustainable. As it stands right now, a lot of the financing for most of the solutions that we have in not necessarily Kenya, but in Africa are from outside, yeah? So that means the moment you have financing runs most of the solutions. That's the unfortunate thing. I think it answers one of the questions that, the next question that you asked me, financing, resources in general, yeah? So when you look at sustainability, it's also about thinking of ways we can generate these resources for ourselves, yeah? So that we are not necessarily relying on a certain messiah to save us. So that's what I wanted to add to what Dauda had stated earlier.
Yes, thank you very much.
Can I go on to answer your next question?
Yes, please.
Or thank you. So
Yes.
this is a question which most of the time you'd think you'd want to answer it as an outsider, but having been introduced to One Health earlier on when I was in school and now practicing as a medical doctor, I can say for sure these have been some of the challenges that I've said impeded me. I've done a lot of things still within the One Health arena as a medical doctor, but there's still more I'd have loved to do, but have not yet been able to do because of some of these challenges. And then when you look at it at the macro level, these are some of the things that will impede or are likely to impede youth when they're attempting to aid in social economic resilience. One, like I had stated earlier on, and I think I want to emphasize this, is we are trained in silos. We are trained in silos. Most often than not, we will even date in silos. So you'll find more likely to be dating a colleague in medicine or at the hospital. I might never ever interact with anyone outside the human medical sphere, yeah, except for such opportunities. So you'll find 70% of people who particularly even go to school and are limited within a particular career, just locked in within that area. And I think that poses a huge challenge, especially when whatever knowledge you've gathered in school, you're supposed now to be implementing at the community level, but again, you're implementing in silos, yeah? So I think that's one major challenge. The other huge challenge is usually a lack of resources. Many times we tend to detach and put this as one of the things that shouldn't influence much, because if you're motivated enough, there are many opportunities to raise some of these resources. But it's always clear that financing, infrastructure, lack of platforms where people can generally communicate and interact well can affect this. When you have limited, when you're even utilizing the resources that you have, but you're utilizing them in a manner that is not intelligent, it becomes a wastage, you get. Then the other thing I feel we struggle with as youth is lack of knowledge and awareness. And you can look at it from multiple angles. One way you can look at it is, like I had stated earlier on, we lack the awareness that we need to work together. And that when we work together, we have a synergistic output. When you have vets, medics, even computer analysts, meteorologists working together, you're more likely to predict, say, you're not necessarily, in Kenya, we were anticipating the heavy rains, El Nino, but we'd not have been looking at it from this perspective. We'd be looking at it from a perspective where, yes, we're having the heavy rains coming. What industries will be affected? And how will we bounce back, like they're saying, bounce back stronger from it? Where with El Nino comes diseases. We are thinking we have diseases that are affecting human health. We have diseases that are affecting animal health. How is it affecting food security? All these are different perspectives, and we're discussing only one point. I still feel as a youth, even as I interact with my colleagues, that we lack that knowledge and awareness. And the other thing that we've not accepted really is we've not understood the benefit, or fully understood the importance of having that social economic resilience, and that ties us down. Of course, there are other issues like institutional barriers, policy issues to do with policy. Right now, we are talking about a major issue when it comes to gender and equity. We've talked about generally lack of collaboration, even within the specific professional dockets. So broadly, those are the things I can think of, on top of my head.
Yeah.
Thank you so
Thank
much,
you
Dr.
very
Samantha.
much.
Dr. Dauda, I don't know if I should incorporate Professor Fashina into one of our panelists.
Yes,
because my
I
next
was
question
about to say
is
that
like,
because the last question you asked is just screaming his presentation. Yeah, there's a particular slide where he
yes,
actually mentioned all of these, like ways forward and
exactly,
how we can achieve it. Yeah. So
exactly,
everything
yes.
Dr. Sam just said like resonated one of the slides in his presentation. So I'd like to invite him, let him join us in the
Yes.
panel, but
My
we
next,
have a
yes, my next
robust
question is
conversation
for
here.
him. Yes. Welcome, Professor Fashina. The question I have for you is, like Dr. Samantha said, we the youth, no matter how we try to look at it, we don't have enough information and education about what this One Health, the concept of One Health, and how to incorporate it into our lives. I, for one, would like to give a small story on a lighter mode about how I first heard about One Health. This was about 7 years ago. I had seen it because I read a lot. I'm addicted to reading anything and everything. So I had seen the One Health, but each time I see it, I just scroll that One Health. What are they trying to talk about? This doesn't make sense. So until while I was doing my PhD about 5 years ago, I was approached by one brilliant student who told me that, please, Ma, I want you to talk to us about this concept of One Health. This thing seems to be coming up, and I think it's really going to gain traction in the next few years. What is your take about One Health? How do you think it would affect the African continent as a whole? And I just told myself, they found me again, this brilliant young boy. So I just told him One Health. My thought was that One Health means every vet doctor should have knowledge on human medicine. Every human medicine should have knowledge on veterinary, so that you can start spending, instead of 6 years, you can start spending like 10 years, so that as a vet, you'll be able to treat a human. It was just crazy in my head, and I refused to learn. To the glory of God, that student was Dr. Dauda Onawale. After that conversation, I went back and I redesigned my PhD to have a One Health perspective, because I was blown away. I was like, how can this young student, at the time I thought maybe he would have been in his 300 level or so, and I was doing my PhD, and so that is to show you that in Africa we have our knowledge. It must have increased by now, but I'd like you to answer the question: what makes up the One Health force in Africa, and how can the government and various organizations and institutions, how can they help to grow One Health in Africa as a whole? Thank you so much, sir.
Okay, yeah, thank you very much, Dr. Balogun Raji. And thank you, Samantha. You actually started this same question with your talk about how we were trained. We were trained in silo. And, the form of our training in our education institution is compartmentalized. For example, if you really want to integrate One Health training in the university, there need to be some courses where you see medical, veterinary, environmental students sitting together in the same class and undertaking the same course together, and then planning joint solution, maybe having some small project they will deliver at the end of such courses. And we find such interesting, like when I was in Tanzania, when I was leading the project in Tanzania, we test run this. We pick 50 students, 25 from Sokoine University of Agriculture in Tanzania, in Morogoro. We picked 20 medical students from the MUHAS. That's MUHAS is Muhimbili University of Health and Allied Sciences. And we picked another 10 students of health informatics and environment. Then we blended them together. We went to Moshi. Moshi is at the base of Mount Kilimanjaro. And this community used to have major challenges with rabies, because you remember at the base of Mount Kilimanjaro, you have a lot of wildlife that come into the community, fight with domestic dog. They introduce rabies to them. They even we saw some of the primary school kids that were beaten by wildlife on their face and on their arm and all those things. We saw this. And this community used to have at least 12 cases of rabies every month. So we designed this program and we said, no, we know that there is not enough resources at the community level to intervene because even the local governments, they have the vets and the medical, which are not enough. Then we added these 50 students to them to work together. And interestingly, we got funding for this because it's a special program. We got funding for it from USAID, and they intervened. Actually, it shows us some few things. One, there is capacity at the subnational level. Never underrate the fact that subnational don't have capacity. In most cases, people that sit in the central do think that, oh, we know much. They don't know anything. That is not true. We got very interesting results led by the local government officials themselves. And we were able to document it. We actually published about 3 peer-reviewed publications from it. And the interesting thing is that at the end of the project, they documented everything that they did from the local government and gave us a very comprehensive report. Indeed, at the end of the day, from the FAO headquarters here in Rome, we were sent a thank you message in Tanzania. You know why? Because at the White House in US, it was reported in the White House press release that yes, the US government has supported this program and it achieved this, achieved that. And it was really blown out of proportion at the end of the day. So they came back to us and tell us, oh, thank you for what you did, this, and that. But we said, but some of you people said we shouldn't intervene before, that we should not go directly to the local government because the national government will not be happy with it. You see, really, if you need to really begin to design a comprehensive One Health solution that is appropriate and meeting the need, you cannot rule out the society. It has to be the whole of society approach in the first instance. The community, like some of the discussion talked by Dr. Dauda as well as Samantha, you need to involve the people on the ground. They know the problem, they know their challenge. Like Dr. Mukonja, we know that in Kenya, for instance, there are some very beautiful markets that government built along the road when you are going towards Naivasha and some places. The local people, they still don't use this nicely built market. They still sell on the side of the road because their problem is not market. If their problem is water and you build road for them, or their problem is primary school and you build very good health facility for them, they will not use it because you are not meeting their need. So we need to begin to include the people at the locality one. Secondly, we need to begin to develop enabling policy that can help us operationalize it. For example, in most of the ministry, I can tell you in most African countries, you cannot share resources between one ministry and the other. It is not possible. So, for example, let's say you need to intervene in One Health now. The Ministry of Health, they have some reserve fund they can pull quickly and they put it down to support the health staff. How do you support the livestock health staff? Possibly they're able to bring some money. Then how do you support the environmental health staff? They hardly had funding to do such support. Then you find out that you still don't have that comprehensive One Health implemented. So some of the things we can do in terms of enabling policy, like one of the paper we prepared for Oreka, we suggested to them that it's possible. Every ministry need to begin to have a One Health desk, wherein, every time they are doing discussion, at least the issue of One Health can be brought up. There's somebody is a One Health defender at the ministry level who always raise that issue and say, oh, when we are doing budgeting, let's think of budgeting something for One Health to support our One Health activity. When we are doing planning, let's plan something towards One Health. In the month of November, we'll be doing One Health Day. What is our plan and all those things? So apart from that, some of these policy change need to come in. Then you need to begin to, as I've talked about training, begin to train people together. And then we should begin to see One Health beyond just another theoretical framework, which need to begin to practicalize it. Even like in the US now, I know that they've designed course for One Health at primary school and secondary school level. So in primary school, they begin to teach them the concept of One Health through hygiene and environment. Okay, you have a dog. How do you manage your dog to minimize disease risk? So they have for the primary, I think they call it K4, something like that. If you check on the One Health Commission, those programs are there, which they design for primary and secondary education. So we need to begin to think of some of these. The boundaries are limitless. but you just need creativity that arises from every country and that is contextualized to the country need. Thank you.
My second question goes to Professor Fashina. Yes. So for youths that want to advocate for One Health to be incorporated in their curriculum, how do they go about this? How do they go about advocacy and policy for sustainable development as well as curricular changes? Thank you.
Okay. Yeah, you know that for curricular changes, actually every university, you know, the basis of university in the first instance, or the basis of institution of higher learning, is supposed to be institutions that are addressing the societal problem. That is the origin of university education. You create a group of experts who are creating solutions that is addressing the societal problem. So if you have a university or an institution that is not contributing to addressing societal problem, that institution actually need to be scrapped. They are not needed because they are not relevant. That's what it means. So in the first instance, our institution need to begin to think. For example, normally every 3 to 5 years, every universities or every institution of higher learning need to review its curriculum. Is our curriculum meeting the need? For example, I went into some UK universities yesterday. I saw some program which they are facing out between 2024 and 2026 because they've grown past those challenges and they are moving into new program that will be designed to meet the need of the society. So every institution needs to begin to work on its curriculum locally. And when students see challenges also, for example, it may be the dean of students or it may be the faculty officer in charge of academic and all those things, they should be willing and they should be open to new ideas. For example, I was discussing with an old professor at the University of Nairobi, just I think late last year, and we had a student who is doing PhD utilizing One Health approach. And this professor said, what is that One Health, by the way? It has no relevance. People are just looking for. I said, sir, you at your level, a whole professor saying this, and that is his stand because he's a very old professor and he doesn't think this thing is really relevant. So I began to give him some context to support the idea of One Health. And I said, sir, you've done this, you've done that. Indeed, there was a recent paper that was released that was talking that One Health, is it an old approach being redacted or something new? It's really not new. So I told the prof, you've done this, you've done that. Do you think that is One Health or don't you know? And so we were able to discuss this, and then it began to open up because he really was out for the PhD student during his defense to tackle him and say, you've done nothing because there is nothing called One Health, just forget it. So but by the time we finished, he was able to have a change of mind. So we should have academic that are open to new ideas. We should have opportunities for us to be able to bring innovative approach to addressing old problems. For example, I have one of my PhD students currently is working in Nigeria and is tackling the issue of salmonella, non-typhoidal salmonella. And I told him, you will work on non-typhoidal salmonella, but from the One Health point of view. And so currently, he had recently done the economic burden for non-typhoidal salmonella, which is published in One Health. He's recently submitted 2 papers to Public Health and another Public Health journal on the cost effectiveness and cost benefit of intervening using One Health and using the current approach, and comparing which one is much cost effective. Because one of the challenge we also have as scientists is that we don't communicate rightly as scientists. You see, most of us are trained to like our microscope, to like our syringe and needle. We don't know how to communicate with the society. So you do very fantastic work, but you don't know how to communicate it across to policymaker, to politician. You need to convince a politician as a vet on why he should invest in One Health. You are telling him, oh, 50 cow will die, 100 cow will have rabies if you don't do this. It meant no meaning to him. But tell him, if this 50 cow died, then so number of farmers will move further into the rural area. During the election time, you won't have them to vote for you. Then you will get his attention immediately. So I will need to also make the journalist our friend. Communicate. For example, we need to begin to design specific program. We train journalists. Oh, you need to help us communicate this, communicate that, and train them on how to do those communication. Make those journalists your friend. You find out your message, you get out there. Late Sir Amadou Bello, he said that they will tell you not to blow your own trumpet. He said, but if you fail to blow your own trumpet, everybody will be busy blowing theirs, that it is only your trumpet that will not be blown. And there's also a saying that if you refuse to market yourself, by the time they want to sell you, because you are not performing, they will actually market you to sell you again. They will put you on the market and market you to sell you. So we need to actually move from our comfort zone of doing science to also including communicating our science. For example, we did, after that program I mentioned of in Moshi in Tanzania, we called together a set of sponsors and funders, and we showcase what we did to them, and we tell them, oh, do you know, we will have done more if to say we have more money. What we did, we call it a breakfast meeting with donor. So we presented what we did, and we said we will have done more if to say we have money. Do you know, in that breakfast meeting, which we organized with less than $7,000, we raised $400,000 easily. Yeah, people willingly committed and say, oh, we want to support you, we want to be part of something like this. So we need to begin to learn how to communicate rightly, and we should have leadership in the academia who is also willing to adopt changes. Otherwise, the youth, I believe the youth are willing, and the youth has the capacity, and they can do a lot if we open them. For example, some of the students we used in the program in Moshi, I tell you, 4 of them got international NGO job at the end of that program, and 1 of them got PhD scholarship to Australia. He's almost finishing his PhD now. So all this, we need to think of how to integrate them together and communicate rightly. Thank you.
Thank you so much, Professor. Thank you. One important thing I got.
Dr. Sharifat, can I add something? Yeah. Okay, it's okay.
Yes, you will. I wanted to say something to the prof. So many things are done in the laboratories in our research institutes, but are not communicated. And when even communicated, you see it's done as if you are talking to just another set of scientists. You see people prefer to just go and publish the things for the scientific community, forgetting that the number of non-science people are even more. That was why there was so much misinformation during the COVID-19. There were some people saying so many things that were not, because the science community refused to communicate in the language that the non-science people would understand. So going forward, I'd like to advocate that all of us here try and communicate on One Health, as well as on how it would affect youths and everyone as far as our health and sustainable livelihood is concerned. And this would go away in educating more people to avoid doing things that would not be productive, whether in the institutional level, the organizational level, as well as in the academic sector. Thank you so much, Professor. We really appreciate your input. Then over to you, Dr. Samantha. Could you please go ahead with your input?
Okay, thank you so much. There's something Prof has mentioned that got me really excited, because it reminded me of the time when I was in school. Like, most of your conversation was largely focused on the student, and it brings out two sides, yeah? It shows once you're in an opportunity and university environment, or an opportunity where you're able to mingle with other people, the ideas are fresh, the enthusiasm is there. The capacity, like you have stated, can also be seen as a separate resource on its own, yeah? Put aside finances, put aside all these things. If you put together youth, any group, most of the time you'll find them at the university level, any group, and you challenge them with a problem, they are highly likely to come up with a solution. And I think you've given examples where the solutions can be as beautiful as even taking them to the next step, or getting them a scholarship, or getting them to places where they're debating about now implementation and are now given resources to implement. Even as you're stating this, the other side is also coming out here, that emphasis also needs to be put so that we have institutions or forum that are bringing out now these other groups that are not in universities, so that they still come back and work together and generate this sort of outputs and outcomes. Because one of the major challenges we face, trying to recall back when I was in uni, in as much as the focus was on implementation, there was also a huge push on academic, which again is quite traditional, and meeting the university requirements and leaving the university. So most of the things are usually done as adventure. So when you have a student One Health Innovation Club at the university level and you task them with a challenge to, say, solve COVID-19 problems, they just see it as an adventure. They come up with very beautiful innovation, but it ends there. Then you finish school and you realize these solutions are needed in the community. It wasn't just a game, yeah? These are solutions that can actually have impact in terms of for that community or generations to come. And some of that impact is even economic, yeah, which is largely motivates many governments. But now they're out and they don't again have this forum to come back as individuals from multiple disciplines to again brainstorm and push something to a point of actual implementation. I just wanted to state that, and as maybe a call to action, encourage each of us to also work not just within the institutions that we have, but also outside that, so that we push for implementation of One Health solution, One Health programs, and have still that enthusiasm of youth and that studentship enthusiasm as we push for these solutions. Yeah.
Thank you so much, Dr. Samantha. Thank you for your input. I can see that Dr. Alimi is around. If you are ready, I have just one question because we're running out of time. Just one question before we round up quickly. Dr. Yusuf Alimi, are you here with me?
Yeah, Dr. Sharifat, I must apologize. I was told it's 5 o'clock, but our timing just recently changed. Before, Nigeria and the UK were on the same timing. So when I was told I should show up 5 o'clock, in my head it was 5. And then I was waiting for 5. That's why I logged in a few minutes to 5 UK time. I forgot that Nigerian time is 1 hour behind. I'm totally so sorry. I'm so sorry about this.
Thank you so much. Yeah. We're so happy to have you, and we know you'd have a lot to give us, despite the fact that the time is short. You have a history of creating opportunities for students, for early career researchers in development and other phases to give them career boost and visibility. For a young student or early career professional trying to get career development in the One Health, what are the advices that you could give so that the student has more impact for whatever aspect of One Health they are about to embark on? Thank you so much.
Thank you for your question. I would say that the first thing is, I think most students, what we need to do, we need to give ourselves permission to see ourselves as stakeholders in One Health, in any One Health related field. There's this thing about the meat of expertise. Most of us assume that we have to have gotten master's, PhD, before we have to graduate from university before we become experts, so to speak. But the reality is that you are actually an expert because what you know, the other person on the street probably doesn't know. So that already gives you 1 or 2 steps ahead. So if you're 1 or 2 steps ahead of somebody, you're already an expert. So what you need next is to give yourself permission to manifest that expertise. And there are different ways we can do it. The first thing is to begin to lend your voice to issues related to One Health. I'm sure a lot of what I'm saying has been reiterated by a lot of people earlier, but I wasn't here. I'm so sorry, but I'm just going to summarize it from my own perspective. So I think the first thing is taking ownership of the issues by lending your voice. And today, all of us have access to social media. We have access to a lot of thought leadership tools. We have access to blogs, online blogs. If you write an article on One Health related issue, you can actually disseminate it to the world. You can get on platforms that were previously not accessible to you thanks to the internet. So you need to start taking ownership by using your voice. And then number two, you need to set a plan for your career trajectory. Now is the time to start asking yourself, okay, One Health is a broad field. Which specifics am I interested in? So when
listen to my Oga.
When you achieve clarity,
Lola
when
Lawal, could
you
you
get
please mute
clarity,
Lola Lawal?
No,
when
I'm,
you
I'm
get
taking care of
clarity,
it.
the earlier you get clarity about your goals in relation to career development, the better it will be for you to set out. So like if imagine you were in school, you already know that, okay, you're interested in issues of maybe rabies advocacy, and you start lending your voice. That will give you a leverage, because as a student, you are probably very few students are owning that space. So you can begin to own that space. And by so doing, you have a record of activities you're doing. When I check your social media as a One Health enthusiast, I should be able to see that you're doing some activities related to One Health. When I check your trail on your digital footprint, how have you been, are you hosting programs like this? Are you lending your voice? Are you participating in seminars, in webinars, in conferences and all that? Because you have to be in the room for your voice to be heard. If you're not in the room, it could be a digital room like this, an online room, or it could be actually a physical room, like a conference, like a seminar, and like all these networking opportunities. So that's one thing. Oh, they're declaring expertise, owning your expertise, then lending your voice to issues. And then there's also the aspect of networking, because when it comes to career development or even getting opportunities generally, it's really all about networking. So networking is not really just about reaching out to the bosses. It could also be reaching out to other partners that are colleagues, that are peers, to organize things like this, to build platforms, to put yourself collectively out there. So you need to network within your peers and above your peer group. And even, below, with people that you can also mentor. Because the idea is that you are a leader. You have people that are looking up to you. You have people you're looking up to, and you have people that are within your peer, your network. So it's a three-way networking program. It's not just, okay, trying to network with someone like Professor Fashino. You want him to be your mentor. Everybody keeps saying that, do you know how many emails he probably gets of people that want him to be their mentor? So he probably will not have time. But you can also network with other people, at different levels. And what happens when you have a backdrop of work available, you have proof that you have done stuff, they can actually see you. So the more visible you are, the more opportunities will come knocking at you, rather than you seeking opportunities only. And then number three is to, again, there's the aspect of education. Yes, even though I said you're already an expert, but you also need to educate yourself more, because whether you're a vet, you're a medic, or you're a public health person, or even agriculturist or microbiologist, the continual improvement of your professional knowledge and skills is very important. That's where things like further studies, like master's, PhD, or any other opportunity for training can come in. Mind you, this is not compulsory. It's not compulsory for everybody, because it's not all of us that are going to get masters or PhD. But the one that is unforgivable is the fact that people think that after getting their undergraduate degree, that's all. There's no more studying. No, you can study in terms of doing short courses here and there, and there are a lot of opportunities for short courses. Again, the internet is your friend. Google is your friend. The internet is your friend. And honestly, it's really just about trying it out. If you don't apply, if you don't put yourself out there, you're not going to get it. But the more you try and put yourself out there, the more the opportunities come. You might fail sometimes. Most likely you will fail. But the more you keep trying, you learn from your trials, and then you get better. I wish I had more time to expatiate on these ideas, but it's just basically, I'm sure it's something you've heard, everybody, there's nothing I've said that is new, but it's just to summarize my own experience. I'd like to leave it here. Okay.
Yes, thank you so much. You've done so much. Yes, you totally answered my question. Give yourself the permission. Sometimes you minimize yourself and your achievements, and you don't want to put yourself out. You think you know so little, and you don't know that even a lot of people in the grassroots have never heard of the word called rabies. While I was planning a One Health team rabies awareness campaign and vaccination, I realized that people just went into the field in Gwagwalada and were communicating with the people in the grassroots. And they said they know that the dog, something is wrong with the dog, but they don't even know what it is. They don't know there's a word called rabies or there's a vaccine available. You can imagine how close Gwagwalada is to the FCT. And the people don't even know that there's anything called rabies vaccine, or they just say, the dog, they mad. The dog, they mad. And as soon as they see the dog approaching, they run with their dogs in. They know something is wrong with the mad dog, that is going to fight their dog, but that is going to give their dog rabies through bites, through saliva. That is a knowledge they don't know. As little as that is very important and very, very vital to the life of women and youth who are the most hit. Women and children who are the most hit by rabies in Africa as a whole. So thank you so much for your input. So over to you, Dr. Dauda. I'd like to hand off my moderation.
Right. Thank you so much, everyone. I honestly believe that thank you is just too weak to express my gratitude to Professor Fashina, Dr. Sam, Dr. Sam, yes, Dr. Sherifat, Dr. Sam again, Samantha this time around, and then Dr. Yusuf Alimi. Well, your lateness is partly my fault then. I should have, been a little more specific when I was reminding you about the timing. But all in all, you still, brought in fresh perspectives, and we really appreciate that. So thank you, everyone. It is deeply appreciated. We convene again by 3 p.m. tomorrow, and it all ends by 6 p.m. tomorrow. And by the end of the event tomorrow, there will be an attendance list that will be passed so that we can design certificates for everybody that participated. You shouldn't put in all of this without something to show for the fact that, yeah, you are part of this. And as I said, it will not end here. Before the next session, there are things that Professor Fashina said that is like a call to action to us as an organization, and we'll definitely be working on that, specifically on the capacity building. We'll call him again. We are calling Dr. Sam again. Dr. Yusuf is coming back again. But before the next edition is going to be to teach us something specific, how to do this, how to do that, and so that we can all get better at what we do and in our efforts towards attaining sustainable development in Africa. So thank you, everyone. I can't wait to see you all tomorrow. I know we all had 3 hours. I really, really appreciate the time and the effort you all put in. And oh, no, Dr. Yusuf will be coming back tomorrow. Don't worry. So we don't need to call him again. The tradition here is that after an event, we all turn on our cameras, we take a screenshot, and yes, something to, end it well. So as we all say bye-bye, kindly try to turn on your camera so we can take a screenshot and we can include it in our report. So let me see the thing. I know it's a little bit dark in most part, and for the East Africans, it's around 8 p.m. Sam, I mean Swahili people, can you help us stop them? All right, thank you. That's okay. Yeah, Dr. Marilyn, we can't wait for your presentation tomorrow. So, all right.
Thank you so much.
So,
goodbye.
Yeah, bye-bye. Good night. Don't just say bye-bye, wave your hand, and yeah. Thank you.